Welcome to Canine Revolution Radio. Presented by Canine Revolution Dog Training, enhancing the dog and owner relationship through education, balance, and pack instinct.
All right, everybody, welcome back to another episode of Canine Revolution Radio. We're very honored today to be sitting down with Nicole. She's a traveling vet, so we're going to get right into the discussion here. And Nicole, if you don't mind, just kind of giving us a little bit of background on you, where you grew up, how you got into the vet world, and kind of where you're at right now.
Sure. Yeah. Thanks so much for having me. And I'm honored to be here as well. And just to give you the introduction, I'm from the Lowcountry, born and raised here in Charleston. Grew up mostly in Cottageville and Walterboro, so not too far from here.
Yeah.
And just always wanted to work with animals, loved animals, owned them forever. And decided to start working for a vet, small town in Walterboro, just to get experience. Went into deciding that, yes, I wanted to be a veterinarian. So I went to Clemson and received my BS degree in
Go Tigers.
Animal science. That's right. Go Tigers. And from there, 4 years, and decided, hey, yes, I'm ready to do this, and started applying for vet school. Applied to like 12 different schools, and it is pretty steep to get in and competitive in that area.
Yeah.
So I ended up getting a couple of offers and decided University of Tennessee was where I wanted to attend vet school. So
nice.
4 more years there, and graduated in year 2004 from vet school. So So I've been practicing now. I didn't even do the math. 17. Yeah, it goes by really fast, and before you know it, all 8 years of schooling does pay off. And when I graduated, I knew I worked through whether I was going to do large animal, small animal. I knew I wanted to work with dogs and cats. So I went out and followed my husband right now. At the time, he took a job out in Las Vegas, and that seemed like a crazy place to go. But
it's kind of crazy out there.
The veterinarian that owned like 10 different practices, it became more of an internship. Worked 70 hours. Did emergencies, and that first year and a half was pretty strenuous. And then I missed home, wanted to get back, be back with family. So I relocated back, and then my husband followed, and we started off in Charleston area in West Ashley, and worked for a vet in Mount Pleasant, so commuted at that time, and did about a year under Dr. Hinkie at Palmetto Veterinary Hospital. And then my husband came out and got his job at Goose Creek Veterinary Clinic, not too far from you guys here. And I ended up joining their practice as part-time since I started having children, and then things changed.
Absolutely.
And you needed to be a little more part-time. So from there, I worked at Goose Creek for about 11 years. And then I decided it was time to just really take a step back after, my third child, and I started thinking about starting my own practice and how I wanted to do that. I did relief work for a while, and it was really cool because I could go to different vet clinics, see a little bit of their style of practice, and kind of started getting that niche where I was like, I really going from every 15, 20-minute appointments and that fast-paced wasn't really a great fit for me. And I enjoyed that more, building the relationship and spending the time with clients and their pets and really understanding more about them and really just bonding. And coming into the home was never what I thought I was going to be a house call vet. So that it all developed over time, and then I decided I'm going to just start my own practice, and I did that in October and got going around 2015. And then I got a phone call from another traveling house call vet, had been in the area and been doing it for 20 years, Dr. Carol Fulton, and she said, I'm retiring, and do you want to take over my clients for their house call practice. And I was like, okay, well, I'm just getting started. I don't know. And then she's like, yeah, if you could take them over in December, I'm ready to. So it was just such a blessing. I couldn't have asked for a better setup. And so I went from having no clients to, 300 to 500 clients. And I mostly traveled to Mount Pleasant. But I will go all over the Lowcountry area. It's hard to get out this far, but every so often I've made, some calls to Somerville area.
Absolutely.
So now I'm a one doctor show, which is maybe not advisable for all doctors because I don't have a tech and would have never thought I would be asking my clients to help me hold their pet and do things. But it's just been a great setup. And so I'm excited to keep going at this point.
They probably like that too.
Yeah.
Having you come into their home, they're like, my dog's more comfortable, my cat's more comfortable, I can help.
Right.
You know what I'm saying? So one quick question on your background a little bit.
Yeah.
When you were growing up in Walterboro and Cottageville area and you started working with a vet clinic there, were you in high school? Were you out of high school? Like I know there's a lot of young people looking, I want to be a vet,
Yes.
How soon should they be starting to get involved in it?
It's a great question, and we get this question so often and from different ages. And so, I started knowing probably about middle school that I wanted to be a vet.
Okay. Yeah.
And at one point I thought I wanted to be a zoologist. I really didn't know. But at that point, I actually did some work for Dr. DeLoach, who I think is still practicing.
Okay.
Small little vet clinic. You do everything in one room, and I just answered the phones and cleaned and helped do whatever needed to be helped done. And that was about probably I would say my junior year of high school.
Yeah.
Senior year. And then from there I would work summer jobs. But the more experience you can get to kind of see it for yourself, what you would be doing day in and day out.
Yeah.
The other probably biggest component is just the academics. Just dedicating it to yourself to the studying and making the highest grades you can.
Yeah.
Of course, testing and things like that come into play when it comes to getting accepted into college. And that's changed a lot. So I haven't really since COVID. I know they've changed things on SAT but it's a lot of testing but you really do want to start building that resume.
Yeah.
And some schools, like for instance, some veterinary schools at Tennessee, they weighed heavily on even the interview process. So something to like this across the table.
Yeah.
And you're having to do a 15-minute interview.
Really, before they even accept you in, they'll have you come in for an interview.
Yeah.
Okay.
Not all schools interview.
Yeah.
So like University of Georgia, I was a 6th place alternate to get into vet school there. There was no interview process. It's all just transcripts, testing, your GPA.
Yeah.
That, and it could come down to a 1/10 of a point that puts you above the other candidates. So it is very competitive.
That's good though. You don't just want anybody out there, handling the animals and taking care of them. You know? Now, what point in vet school do you break off from, like you talked about selecting large animals like maybe horses, cats and dogs? Like at what point in the school do you break out into a specific field or specific animal?
It depends on the school. I think like Mississippi State sometimes would start their clinics sooner, but we did 3 years of academics and the final year was your clinical year.
Okay, so that's when you focused on.
And then you could decide on taking more electives. If you thought you wanted to work with equine, then you could take additional courses. You do have some choices. Like everyone takes sometimes the same courses right on up through the first 2 years of vet school.
Right.
And then in that third year, you can start branching out a little bit.
Yeah.
But even then, your clinics, you're in the barn, and you have to put your hours in just like every student. And then when it comes time to finally taking your finalized boards, you're going to be tested on all the subjects.
Everything.
And they give you, you're going to probably see more on certain subjects, like less on chickens and exotics, because that wasn't part of the bigger part of the curriculum.
Right.
But you do need to you just have to learn it all.
Yeah.
So it's a lot of study.
Cool.
It was a lot of late nights in the library.
Absolutely.
And you're all in. But it takes time to really get all in.
Yeah.
You're not expected to really know. And even then, I thought at one point I wanted to go into equine. and do reproductive. And, so it changed. It
Changes
changed.
as you go.
And as I got into it,
Yeah.
and sometimes you still don't know, and you get out and you go to a practice and you figure it out. Like, do I like medicine? Do I like surgery better?
Yeah.
And then you can continue to build on that by taking extra courses and going for more CE. And still learned more in the first 5 years practicing than I.
Of course, yeah.
would
Now
have.
you're taking your academics, applying it to what you're like, holy cow,
Exactly.
I learned that, but here it is in real life. You know what I'm saying?
Exactly. Yes. And like going in, I would have thought I was going to be practicing differently, and someone said house calls, I would have thought, for euthanasia, but not for like what I'm doing now. So it's evolved.
And the majority of house calls you're doing, what are they for? Is it like your annual checkup, vaccinations, euthanasia?
It is. I would say about still half of what I do is probably just your classic preventative care, vaccinations, heartworm and testing, blood work. I do see sick patients. It's just hard because sometimes they don't get sick on a schedule. So I usually always have to have a backup. And we're fortunate to have so many great veterinarians in our area, as well as 24-hour clinics that can see pets whenever they get sick.
So if someone calls you with like a sick pet, you're like, hey, I'm 100% booked. You should go over to this person or what? Yeah.
And I do a lot of telemedicine triage over the phone, particularly for my clients that I know well and know their pets, and then I'm able to really help guide. But when in doubt, we just don't wait on me. You go on in.
Absolutely.
And then I refer a lot to my husband's clinic over at Goose Creek for anything for surgery, critical care, hospitalization, if it's close enough for people to drive. So.
How many snake bites are you seeing this time of year?
It's
summertime in South Carolina for the listeners,
Can you move your mic a little bit?
Yes.
Okay. Just scoot it towards you.
Yeah.
There you
Is that better?
You can move it closer if
You
you want.
want to lick a little? Leaning leg forward. Oh, gotcha. Get comfortable.
If you lean back, you can just
Then
pull
I'm
this
like,
back.
Turn yours towards
Let's adjust it. Okay,
Yeah.
perfect. I just saw a snake bite about 2 weeks ago on a really older patient. So I came out and there's swelling of his limb, and I'm thinking this is something really bad. And then we, upon investigation, you find some puncture wounds.
Found the two. You know what kind of snake it was, or
no? I would have probably guessed copperhead because
Really?
if anything like a rattlesnake, it would have been.
rattlesnake
3 times
venom
as
is
swollen.
super, super potent, right?
And, they didn't realize what had happened. They just thought he was old and he was arthritic. And
My
so
gosh.
some of those types of situations, you just can't do telemedicine. You really need to get your hands on.
What happened? Was this dog able to get anti-venom or like?
No, because it would have been days after.
Oh,
so
gosh.
really most of it's supportive care at that point. Antibiotics, supportive care, pain meds, and they have to just get through it.
Yeah. Dang, that's crazy.
And it would have been more extensive, like hemorrhaging and bruising, if it had been probably a rattlesnake.
Yeah.
So
That's why, from our side, the training behavior side, we say, and I'm not saying these people didn't do that, but we say always be out in the yard with your dog, supervising the environment for them, because dogs are dogs. They're going to sniff something, they see something move.
Yes.
That copperhead might be trying to run away, but if it feels cornered, it turns around and whips them.
That's right.
You can at least see something happening,
And this was right in Mount Pleasant.
Yeah.
In a neighborhood that, homes are on top of each other. So
Right.
this
And a
dog-
lot of those neighborhoods, too, they have the drainage ponds or whatever, and the
Right.
copperheads are all over those things because there's frogs. They're feeding on the frogs. They're feeding on the bugs. So,
Yes.
snakes are a big deal, especially out here with us. We see a lot of snakes, you know what I'm saying?
We do. Yes, yes, you do. And most of the emergency room clinics have the antivenom, for copperheads, rattlesnakes, and I think even coral snakes, because occasionally that we do.
Water moccasins, too.
Yeah. Yeah.
So I don't want to get off on a snake tangent, but
it's okay.
Can you talk a little bit just based, because I'm sure you learned about it in vet school, too.
Sure.
The most venomous snakes in this area, again, for those listeners out there, we're in the Lowcountry, South Carolina, near Charleston. We see copperheads, we see water moccasins, which are also known as cottonmouths, there are coral snakes around the area, and also rattlesnakes, diamondback,
eastern.
what is
Yep.
it, canebrake, timber rattlesnake.
Timber, yep.
So those are like the four or five main venomous snakes we have in this area, if I'm not mistaken.
Yes.
Can you talk about the different venom types, like which one's more venomous than the other? What kind of symptoms could you see?
I wouldn't want to go too far because I don't. At this point, I haven't ever treated with antivenom.
Okay.
It is an emergency room basis.
Right.
There may be an occasional vet you will come across that will carry, but we now refer straight in.
So if someone says we got a snake bite, or
It's an emergency
you
room
go straight to
only.
the ER vet.
Yeah, I don't.
Yeah.
So veterinary specialty care now, Blue Pearl, Charleston Veterinary Referral Center. Those are the main two.
Yeah.
Now up in this area, you may even consider Columbia.
Yeah.
Just
and
depending
Somerville just opened an ER vet.
in Somerville,
Yep.
yes. And so that's Blue Pearl,
Okay.
veterinary specialty care.
Yeah.
The Mount Pleasant and Somerville, same
Gotcha.
one.
Yeah.
But it's truly emergency. And the antivenom is, the key to it is actually has to be given in a very short period of time. So
Okay.
again, if it's days, but most of the time these are going to be a serious situation. And depending on where the bite is, how much venom was actually
Dumped. Yeah.
how close to the bloodstream.
So if the dog gets bit, should you try to limit that dog's movement, because we don't want the blood moving the venom through the body, which might be difficult to do?
I would say it makes sense not to, exert the dog at all and just
Right.
keep them calm and
Right.
quiet and cool, because things can start to happen like shock and hypovolemia, which is basically they just start to, their blood pressure drops, the heart rate shoots up. Those are consequences of the venom.
Right.
Nothing really you can do to stop that process, just how much is administered in.
Yeah.
And then a lot of it, if we miss the window for antivenom, is a lot of just supportive care. So antibiotics in case we become infected in the bite wound area. I mean, it can cause severe necrosis. So then sometimes some things have to be dealt with surgically.
Yeah.
So I've seen them present in so many different ways.
Yeah.
I had out in Las Vegas, we assumed it would have been a rattlesnake.
Yeah.
And this poor dog came in, just face was 3 times
Oh,
swollen. So we
shoot.
know the bite wound was like up in the neck.
Did he survive? Nice.
He did.
Yeah.
And a lot of it's
Takes a while.
hospitalization.
Yeah.
So that's where it gets scary. People want to immediately take their pet home. But sometimes when they say, hey, we need to keep them for monitoring, yes, we know that kind of that expense is extreme, but it is because we don't know what's going to happen
Right.
within the first 12, 24 hours. They can have arrhythmias, they can become septic. It's, it's just kind of a whole gamut of, and then if there's if there's necrosis, then sometimes that takes days to show up. So it's,
Yeah.
And
So-
it is a hard situation when you live like out where you guys live, and then
Yep.
at that point you do the best you can to monitor, and when they're rustling in the bushes and
Oh,
things
yeah.
like that, you want to be able to recall them away.
Yeah, absolute recall. Important. Going back to the training thing. What we do is
Right.
like for us, we try to keep our areas as clean as possible. So keep an underbrush or undergrowth cut,
Right.
treated, keep the insects treated, because that's what they're hunting, insects, frogs, that kind of thing.
Right.
If we see a snake, we identify where it's at. If it's a venomous snake, we're going to take care of that because it poses a threat to the dogs. That's our number one priority. And, we got kids running around sometimes. So we got the kids,
Yes.
we're worried, and employees too, our team
It's
members.
scary.
You know what I'm saying?
It's a scary situation. And
So-
things like having king snakes around are not a bad thing, 'cause
Right.
they will help to take care of some of the venomous snakes.
Absolutely.
But, that's not
We
always
actually just got some guineas too, guinea hens or guinea
Oh,
fowl.
yeah.
Because those things will get the snakes too.
They'll run 'em off.
Absolutely.
That makes
so
sense.
that's what we got some of those for, a little
Hey.
snake deterrent.
Not a bad idea.
But we have done a couple years ago, we did snake aversion training, which I do recommend for anybody that has a dog that's going to be potentially around snakes, which is in this area, a lot of people, which is super hard to do because we're concerned about, safety of the dog while we're
Right.
doing that kind of training. That's why we haven't done it since then. But basically teaching your dog stay away from that scent, that sight,
Yes.
what that thing looks like, what it might smell like, how it moves, stay away from that. You know what I'm saying?
That's
So
awesome.
I
Yeah.
think it's the best thing for the dogs,
Right.
But also as the owner, like you said, recall them if there's something weird going on. They're sniffing something a little too intensely and you can't tell what's going on. Recall them, supervise the environment for them. because that's no joke, with the snake stuff too. So
absolutely.
But anyway, enough about snake going off on that tangent.
No, it's great.
Important to talk
It's
about.
this time of the year,
Yeah.
and it's extremely important.
Yeah.
And what I have done for one of my clients who's out in Edisto, and this comes down to your vet and what they feel comfortable recommending, but we do like a little snake bite kit where I've actually given her some injectables to actually give.
Yeah. So people could talk to their vet too.
Yeah, they wouldn't be able to do intravenous and things like that, but kind of like giving, insulin shots going under the skin or IM, but we do something just to bide us some time because she's got a 45-minute drive off the island.
Yeah.
So, so little things like that, you can talk to your veterinarian, and there may be some preventative kits that they could discuss. Some may not think that would
not
be valuable, but
Gotcha.
I think,
Okay.
What's your range of animals that you work with now? Is it only dogs and cats, or is it snakes? Is it
I know
guinea pig? I don't know, like a pig. What's the range?
I work with dogs and cats only, and it's not that I wouldn't be able to advise on some of the way we call pocket pets, exotics, and so that would be guinea pigs, ferrets, snakes. I just, when you don't have it, they're just totally different species. Very, very different medicine. I was fortunate enough to work when I worked at Goose Creek. Dr. Virginia Brown did work with exotics, and she would see. She didn't see birds. That's a whole nother species. I'm highly allergic to guinea pigs.
Oh, really?
Like,
Really?
I'll break out in hives and start.
Is it the fur, or is it the dandruff they give off?
It can be all of it, and I
crazy.
tested positive. I'm also allergic to cats, and starting to become allergic to dogs. So I've gone through the whole allergy treatment and allergy shots just so I can.
That's what I'm doing right now, because I'm in the same boat too.
And it does. It takes a long time to get, but I decided it just wasn't worth it with the guinea pig. So I just didn't. I didn't see.
So what if you
but
go to
those
somebody...
are like extra classes you would take either while you're in vet school, but most of the time, a lot of people get out and decide, oh, I really like working with this little guinea pig, or I really do want to see snakes, and then they'll go take extra courses, and they can actually get certified in different areas to try. Yeah.
So if you go to someone's house and there's a guinea pig just running around, you're like, we got to do this outside.
And I just mask up and glove. I mask and glove because I have euthanized a few that came in, and it was just like, listen, we'll do what we have to do. So, and there's board. So back to vet school and when you're those areas that you go into, you don't always know, but down the road, then you can decide you can go straight into becoming board certified, which often then adds on additional years. So I didn't really talk about that. But if you said, I have two friends, one that's board certified in equine medicine, another one that's board certified in cardiology, and she had to get board certified in internal and cardiology. So we're talking another 4 years. So then you're looking at 12.
Yeah.
So, and they do more like an internship, and then you kind of then you work at the university. Yeah. So those are, but you can get board certified in exotics, zoo medicine, and just on, and just in individual, species like equine medicine. Yeah. Yeah. So,
we had to take one of our guinea fowls down to somewhere in Mount Pleasant because the guinea had something wrong with its leg, so we had to take it to a specialized vet in Mount Pleasant.
Yeah.
So good to go. Talking about orthopedics real quick. I've seen when I was stationed in California, I took my dogs to like a dog chiropractor, and also a rehab facility. So these types of, are these certifications for like chiropractor or rehab, they go through the same or similar process? Like how would that look?
Yeah, no, great question. Because you can do chiropractic and not be a veterinarian. I know that I don't know that I would really advise someone on that unless they walk through kind of what that person can actually offer.
Right.
But there are additional certifications for rehab. And so physical therapy is another component you would just go to extra. And actually a couple of colleagues in the area go up to University of Tennessee because they have a great PT. Yeah.
PT program.
I don't know exactly how long, but I want to say you go through the classes and then you have to, pass some tests and then submit so, different cases to become certified. But it's a big area, and there's several vets in our area. I've referred recently over to Daniel Island Animal Hospital. There's a rehab
PT over there.
They have one of the vets just started doing it.
Okay.
I know one of the Schuler vets in Mount Pleasant offers it. There is a place called Aqua Therapy over in North Charleston, where the old emergency room used to be off of Montague.
Yep.
And there's a technician where she went to school, I think, to be a physical therapist, and then went back and I think she's been there for
a while. Yeah. What about dog chiropractors in the area? Do you know of any?
There is one, and I'm trying to think of his name, and I think I have his information saved. That I've had a couple people. I did some relief work at Sundog Cat Moon, and I know they used to have someone come in.
Okay.
And it's a gentleman, and he's been doing it for a while. But I haven't had a lot of. I've had one client or two here and there, but not a lot of feedback on how much of it was really helping. But you do get a lot. We do a lot of evidence-based medicine in these areas. So over time, we do get more information coming out showing that this may help.
Right.
And they do try to work. I think it's really a lot of partnering with the vet who's ongoing when they do these referrals. And we do see the underwater treadmill.
Yep.
That's a big deal.
Yep.
I know that place that Whitney works at in North Charleston, they have that type of setup.
Yeah, yeah.
And I had made a referral once for them and just walked through the process, and they do their own consultation, but they look at the records and make sure they understand what the injuries are, and partner with the vet too.
Yeah.
So it's huge. It's just a new area, it's new for us, and I think it would be really great to have, even like for someone like me traveling, coming into the home like we do for people.
Absolutely.
And offer physical therapy right in their home, because you're going to get the best compliance. But I don't know how we do a traveling underwater.
Yeah, that would be difficult.
Have to have it on
you
back of a big
van,
truck, big truck.
I used the underwater treadmill and the chiropractor when I was stationed in California.
Yeah.
Because my Doberman, he was doing some intense training at the time, and it something tweaked his back or something.
Yeah.
And our vet that was out there referred us to the rehab, which the rehab and the chiropractor were in the same office. I guess they were partners.
Sure.
And we did the underwater treadmill, and they had like all these, different things you had to do in the room for rehab, and then you'd be in the chiropractor office, and she would adjust his back, his hips, and like after the problem was resolved, I just went once a month, as like a preventative care thing. You know what I'm saying?
Yes.
It was very valuable. It was big out there, and then whenever we moved back here, it's like, the East Coast isn't caught up to the West Coast as far as that level of pet care, at least from my perspective at this point.
No, I agree with you.
I think we'll be there soon.
Exactly.
But if you're out there on the West Coast, like, pet care is huge,
Yeah, and it's considered a lot of, ancillary or, treatment that's in addition, to, our basic practicing of medicine. Acupuncture is starting to take, and that's been going on. I probably know 10 vets that do acupuncture.
Yeah.
Now the Chi Institute, I know, is where they really should be getting the training. I know that's kind of where a lot of them have been trained, and that's how they get certified.
Yeah.
So and I believe in, I do believe that it can help with pain and, and it's hard because it's really hard to get good studies. You have to have enough patients to really see, and you have to be able to do double-blinded placebo studies. I mean, how do you do that with some of the acupuncture? But I do believe that
it's making an impact.
Yeah, it does. Some of the patients I've referred for these would be chronic arthritis, chronic injuries that are just dealing with a lot of pain.
Yeah, and what acupuncture actually is, especially for the listeners that don't really know, from my understanding, it's where you take the needle. Right, a dry needle, and you insert it to a certain point on the body, and it relieves the tension and pressure in that point.
Right.
Or what exact is that? More than that?
And I, since it's not, I really haven't gotten into it. And I mean, if someone's interested, I just go ahead and refer them right in and let them go to a vet that knows. But I mean, it is basically what you're describing.
Yeah.
And I know there's there's like electrical stimulation type. I've even had that done on myself. For plantar fasciitis on our heel, and I felt great for 2 weeks. So I think there is a niche for it, and there are patients that are gonna benefit. The few that I've sent, I can't say that I have seen extreme differences. But that's not to say it's just you don't get enough. You just don't get enough feedback. Sometimes what I have seen to be a difficult situation is we exhaust ourselves in everything else, surgery and medicine and the conventional, and then the disease process has gone too far. And sometimes at that point, it's really hard to see. I've had people trying everything at once, and then it's really hard to know what's working. So that can kind of muddy the water with some of these modalities to kind of say, okay, what's really helping this pet? And so it's probably good to start as soon as there's an injury or there's a disease process, and start walking through those treatment options, and that's where partnering with your veterinarian. Other things I see mistakes that I think are mistakes, or when clients jump around too much, and they'll jump from one vet to the other, and everything that we deal with takes time. Sometimes it just takes a lot of time to determine exactly what the underlying cause is. Then we have to have time for the treatment plan to work, and then there's the most important part is the follow-up care. And some things just don't get resolved with the first go-around treatment, and sometimes that's when we start adding in more treatment options in order to get the best possible outcome. But I'll partner with the orthopedic, someone that's offering acupuncture. Laser therapy would be another one that we can go on, and it is out there. I have people that are not in a veterinarian or even a licensed tech that are offering
the cold laser treatment and all that.
So, and we have to be very careful because people are out trying to help, but you do really want to make sure you've checked the credentials, get some references too, best place is just to talk to your vet and have them give you their recommendation and refer you, instead of going online. And there are online companies now. I've even been told clients can rent their own lasers. Holy cow. Like cold laser therapy. And so it's just a big area. And we're navigating through it too, trying to figure out how to offer these services and really get it to clients so they have access to it.
Gotcha. All right. So let's talk real quick, two different scenarios. When someone's like, we have a lot of listeners that may not have a dog yet. I just talked to someone yesterday. Hey, loving the podcast. I'm thinking about getting a dog. Really give me a lot of good info. So then we have a lot of people that have had dogs for years. You know what I'm saying? They've had a lot of different experiences. But let's talk about what someone should expect when they go in for a vet visit. Let's say it's for their preventative care, their annual visit. Let's talk about it from going into a vet office versus having someone like you that comes into their home. What would that look like in both scenarios, based on your experience?
It's great. So coming into the vet, or from the first step you're thinking about getting a dog, the best thing to do is to probably do like a consultation if you already have a relationship with your vet, because they can really help walk you through some of those options on just basically matching you up. I mean, there's a lot of resources online, but it can be a little overwhelming. And so you can even set that up with your vet prior. And they'll walk through a lot of that. Most people do a lot of that on their own, and then when they're ready to see their vet, if they're new to an area, that's kind of hard. Word of mouth recommendations is always the best. But of course, Google and check. You can go on their website and really just do your own research. When I do refer my clients to a vet, I always want to make sure too, I'm kind of matching them up a little bit with like personality. Because I do know a lot of vets in the area, and it's kind of nice that we do have a lot of options. Most people choose a veterinarian based on location. That's the biggest reason that vet is right down the street,
Yeah.
close by. And I think that's a great place to start.
Yeah.
You do need easy access. And then from there, I always advise people to go to the vet clinic and do a meet and greet before the appointment. Because when you go on the appointment day, there's so much going on, and who knows how your pet's going to react. And
Fast-paced, high speed going on. Yeah.
and, some things can be done ahead of time. Some vets, like I like to send a new client, new pet form to my clients. I just try to maximize everything I do before I come to the home.
Right.
And that's because I'm doing it all, and I don't want to spend too much time just taking history.
Right.
So get as much information. But, a lot of that's done on that first visit. So, you're going to have to kind of answer a lot of questions usually. So expect that. And sometimes that should be done on every visit, even if we think we know the history of the pet or know what's going on, we're going to still ask those same questions.
Yeah.
So expect to answer a lot of questions, but also come with your own questions, and maybe write them down, especially if you're kind of one to jump around or not forget what I was supposed to ask. I think it's great for the whole family to come in if they can, or if it's a husband and wife. Sometimes, a lot of times we see different family members, and some are more involved in others.
Right,
so,
absolutely.
But a lot can be done on the phone too, so that's
Yeah.
great too. And COVID presented its own challenges. I think we're all about to all start navigating through all of that, and most vet clinics are open to people coming into the clinic.
Yep.
But yeah, so once that, I think you can call, you can get estimates ahead of time. You can talk about what their services are going to involve. A lot of it's online and on their websites.
Yeah.
And you can even learn about the doctors ahead of time. So that can kind of help you. I think one of the biggest concerns we have, or clients express to me, is they go to a clinic, and if it's a busy practice, say it's 3 to 5 veterinarians, sometimes they're seeing a different vet every time. And, if it's a sick visit, it's hard to plan it out. But
Right.
if it's preventative, I usually say, hey, go ahead and plan that appointment.
Yeah.
Or go ahead and plan that appointment 6 months from now, because
Yeah.
you can always change the date. But at least you're going to get in with the doctor that
Right.
you
have a relationship with.
Yes.
And knows you and your dog's history or your cat's
Exactly.
history or whatever.
And from the behavioral standpoint, dogs are going to get used to seeing the same person.
Yep.
And so sometimes first visit's a little rocky, second visit, and by the time the third visit, they're usually
know
much
the
more
drill. Yeah.
acclimated. There's a level of stress that any pet's going to experience from the moment that you pull out the carrier to you open the car door.
Yeah.
We have to address that sometimes before we can even address what's happening in the vet clinic. Many vets are getting pet-free certified, which you would kind of think that everybody's goal is to minimize stress for any pet.
Right.
But there are some step-by-steps to go through. For some vet clinics will advertise that they are certified in that manner.
Right.
So that's a good one to look for.
Yeah.
If you have a cat versus a dog, you probably want to go to a very cat-friendly place. That means separated. You don't want the cat on top of the dog in the waiting room.
Yeah.
I think we've gotten beyond that, but in many places, it's still...
I've been to several vet offices with clients, and it's very crammed in the waiting room.
Exactly.
You know what I'm saying? I'm like, this is too tight. You know
Yeah.
what I'm saying? So,
Yep. So all of those things, and you can talk to your vet ahead of time on what could minimize the stress, especially if you're dealing with an adult dog that we already know has severe anxiety. And there's just could go on and on about that.
Yeah.
And that's, in a way, that's where I get the calls a lot of times that, hey, my dog or cat does just not do well getting in the car.
Yeah.
Hey, they need to sedate them every time, or, gas anesthesia.
Yeah.
The way I start, I always do like a consultation on the phone before I show up. First of all, it's safety reasons, and I
Right.
want to kind of know who I'm coming out to and ask questions ahead of time, get the history, make sure it's a good fit. I don't want to waste anyone's time or money
Right.
coming out if for some reason their dog or cat hides under the bed and we can't get them out.
Right. Right.
So we'll try to set ourselves up for success ahead of time.
Yeah.
So I'll do kind of a meet and greet, and then if the pet is okay with everything that we plan to do, then we just go right on into it. So
Yeah.
same thing, history, physical exam, and then if they need vaccinations, blood testing, fecal, whatever. I can,
Yeah.
for my practice, I'm limited because I'm not able to do hospitalized services. So, no x-rays and no surgery at this time.
Right.
And then I just try to make sure they either have a backup vet or I can help them partner with the vet from the very beginning.
Yeah.
And then the backup plan is always the emergency room or urgent. We now have an urgent care facility in West Ashley.
Nice.
That helps to bridge the gap.
Yeah. So like whenever you walk into someone's house as the vet, different than a vet office, right? Instead of that dog coming out of their environment, coming into the vet environment,
Right.
You're the person coming into that dog's environment. How is it for the most part? You have a lot of dogs that are like, standing up to you, bucking up to you, like, who's this person? Now they want to touch me, type situation. Or, you got 50-50 where some are friendly, some are kind of, iffy. What's it usually like for you?
It is. I'd say, 75% are very acclimated to someone coming into the home. They're already used to me or even my predecessor who did the house call visits for them beforehand. And I don't take as many new clients, particularly that I just don't know.
Right.
So I'm kind of starting to max out on that.
Yeah.
But when I have in the past, I've had a few that, when I come in, if I have a high anxiety, nervous, or just really hyper dog, I do the best I can to ignore them, even though I know it's really hard you want to love on them.
Yeah.
But I try not to feed into it. Many of my clients don't go and grab the leash, which I usually just ask them, I think it'd be better to put them on the leash because they're jumping on me and I'm also afraid sometimes I had a, occasional dog run through the door, so safety's always first.
Right.
And I talk to them, that's kind of too, if I don't already know them, I talk to them, how does your pet do really?
Right.
If there's hesitation, I just go ahead and tell them like, hey, we'll just have to see how it goes. I may have to put a muzzle on, and we'll go from there.
Yeah.
I've learned, through kind of trial and error, that if I'm afraid the dog's going to bite, it's probably not going to work out. Like I usually refer, if I really see aggression, I just tell them, I think it's best that you make a way to get this pet into a veterinary office where we can have 2-3 people.
Right.
Occasionally I used to bring some people out with me if I knew I needed help.
Yeah.
But I just get a good feel over the phone. But I try not to feed into it. I do recommend, like, I'll prescribe things like trazodone and gabapentin and composure, and we'll do all of the extra medication we can to try to take the edge off. Sometimes it works, sometimes it doesn't.
Yeah.
It's more about behavior modification than it is the drugs.
Absolutely.
And we all have learned that the hard way.
That's what we're here for.
Yeah, exactly. And and I got an interest in behavioral medicine along the way prior to doing house call vet checks, and that was, I kind of went to a couple extra courses and went to some training and to learn more, because that in vet school we're given a half a semester course.
I was going to ask if y'all had any training on body language, behavior.
We do, but more of what I learned was on my own, taking the extra CE and the experience. And it's a lot about the experience and just learning to read pets.
Right. And
you're exactly right. We do it without even thinking about it. And then other clients, if they see a dog yawning or lip licking, they do not understand that that's always an anxiety thing. They think like their dog is tired. And I'm like, no. I was like, but I have found with patience and time, and also if I really want to get that blood for the heartworm test, but if that means this dog is going to bite or they're going to get so scared they're never going to let me touch him again, then it's a no-go. Right. And I said, we're going to either try this the next time or I'm going to refer you in for this quick blood draw, let the regular vet and the 3 techs get the blood done safely. Yeah. But I never ask my clients to do anything they're not comfortable with, because and I don't fret a lot about people are like, oh, you could get sued and but that's where the relationship, I'm just making sure we've established a relationship and build on that, and I'm not a volume type setup. So,
and you're concerned about the well-being of that dog, that owner.
Yes.
Versus just in it for the money. You know
yes.
what I'm saying?
I'm likely not to get bit. You would. And that's
Yeah.
my biggest fear,
Yeah.
So we just, now cats is a whole different conversation. I'm a huge cat lover.
Yeah.
And I will deal with cats that are hissing and scratching. And sometimes it just goes slow. You got to, and same thing with dogs. Quiet. I always tell people, please don't have me come out if you're getting like construction work done. I've had that happen. All 3 cats and dog are hiding.
Oh gosh.
And so we just produced a really stressful environment, and it was very little to do with the vet visit. So I was like, let's do it when it's calm, quiet. I've had some people have like this great like music going on and quiet, and I'm relaxed now.
I'm super relaxed. I'll just sit on the couch for a little bit.
Yeah.
That's cool that you get to go into the house and like.
Right.
You're establishing that relationship, and like, a lot of times at a vet office, people feel I'm in, the vet barely, the vet's in, they're doing this,
Yes.
so and so growled at them, they just shoved the muzzle on them real quick, they did this, and they're out.
Yeah.
It's like, done. You know what I'm saying?
Exactly. It's kind of one of the most common complaints that I may get. And sometimes especially with COVID, there was just communication on the phone. So, my husband is a vet, and he was, he said, yes, I haven't seen very few clients at all,
right.
For this past year. And so a lot happens with body language and eye contact and getting people to feel comfortable with you. And it's so important when you're giving them sometimes devastating news or whatever the, treatment plan may be. You have to build the trust. And coming into the environment, yes, there's no like hiding things and making up stories about, and I get to actually see their medication. And if they still have a whole box of heartworm prevention that we sold last year on the, still sitting there with extra doses.
No
we
one's
know
giving it to them.
There's some compliance issues, and just trying and dealing with that, not trying to make people feel guilty.
Right.
The most important thing is they need to understand that, hey, we're pet owners too, and I understand if you came and saw how, I get behind on things, and we all do, and we're just wanting to, partner with you and find the best treatment options available.
Right.
So, and it does take time. I mean, it's, in some visits too, with like behavioral specifically, it would be when the visit was over. In a regular practice, you'd kind of get that question at the last minute, like, hey doc, I got one more question. And it was always that behavior, like they get a little aggressive when the UPS comes, or separation anxiety, and that conversation could really take like 10 to 15 minutes, and you don't want to rush that. You want to make sure, because sometimes behavioral questions can be sometimes so important with the taking care of that pet.
We, obviously we're talking about behavior a lot with our people,
right?
And our phone conversations might be 40 minutes, 60 minutes for one question, because there's like, it's not just this one little thing. It's such a broad thing you need to understand that's revolving around that behavior. You know what I'm saying? So that's where a challenge can be. And especially if it's a vet that's working in a clinic, they're like, they might be, I got to get to my next appointment, and
it's
that's
hard.
That's just a tough.
It's a tough, and
situation.
Our techs are wonderful. Sometimes they'll come in and spend those 20 minutes because they're so knowledgeable, and they know even more maybe how to walk through all of that with clients. But if it truly comes down to a behavioral consult, I've always tried to say, I will dedicate a visit for that. And we'll do half of it with the history form I send you, and then the rest of it when I get there. And I encourage people to take videos and send it. Those are key. And then it really comes down to the partnering, because I'm not a trainer, and so I always want them to partner with the trainer that my client is going to really commit with. So that's important. But we get through it. I mean, I have many dogs that just have bad manners, and we make it work.
And for some people, it's like it doesn't really bother them.
That's right.
Until like there's a vet visit, and then if like the vet and the owner can manage it through the visit, like that's cool. But if it's something that's really bothering the owner, or it's a safety issue, whether it's a safety issue for other people because of aggression, or a safety issue because of the dog, because the dog is so scared that, if they get out of the house and there's a loud noise, they run into a street, boom,
and that's the key. Factors. When I do house call visits, I almost always are in the home. And I'm not really, that's why I don't come up with the traveling van and bring them out to the van, because then we already are going to induce some anxiety.
Right.
Occasionally I have something I've done out in the yard,
Mm-hmm.
but I do try to avoid, just safety first.
Absolutely. Do you have a question?
My only thing is, I was just waiting to see what you guys said, but it's kind of the same. So some people, and this is like when I take my dogs to my vet, I love my vet, but sometimes right when you get in the room, like where they're doing the exam, the vet techs are hyping the dog up even more.
Oh, right.
When your dog, like, I got 2 energetic pit bulls, Chad's got 2 Dobermans, you really got to manage them when you get in there to keep them calm and collected. And those vet techs come in, give them the puppy voice, hey, sweetie, hi, and everyone's getting excited, and then things get out of control. And then when the doctor comes in to actually do the exam, it's like, well, we just took 5 steps backwards, so this is going to make the whole visit a whole lot worse. You know what I'm saying? So
it is.
Yeah.
And some people won't be like, okay, like, let's tone it down in here, or, maybe the tech or the might get a little offended because they're trying to be nice and stuff like that. And so I think some of them have the perception that all dogs are happy-go-lucky. You know what I'm saying? Maybe didn't get that formal training like you got. I don't know all the steps to get.
It is. Yeah. It is really tough because we want them to be excited or just be okay with people. But once the energy level just hits a cert, then it's going to be difficult to manage.
You do that to the wrong dog too, that dog might try to eat you. You know what I'm saying?
Yes.
And I get it, like the people that are doing that, they're trying to make the people comfortable, help the dog be comfortable.
Like a welcoming environment,
a welcoming environment.
One of the things, and that's where, you just probably want to have a talk with the vet, and it gets to a point you're not going to make everybody happy. You can't, and so you're the advocate for your pet, and just go ahead and have that tough conversation. Sometimes some places actually have like these app consultation. You can talk with them, and then they talk with the team, and a lot of feedback is good because when they have their meetings, and these are some of the things they discuss to try to do the ongoing training. And so if you don't feel we're comfortable telling that tech directly, I get it. It's kind of hard, but it's a learning process. But sometimes you can have a setup where some vets will have you just go straight into the room instead of being out in the lobby if you have a reactive dog. That's a big key component. And sometimes, like over at Goose Creek Veterinary Clinic, they have a door that they used to have you could come in from the side, and so that would avoid and go right into the exam room. So
always talk to your vet. Let them just be honest with them.
Just be honest and go ahead and have the conversation in that way. And what we do is we have where we put notes on your record to say, well, that guy. Just kidding. Jerk. And just put the notes to say, and that's what it really helps. And the techs pull that up because you never know which tech. But the other thing is you can ask for a certain tech, like when they're working. There's some techs that work all the time. And you could just say, hey, can I partner up with that tech? And it's no offense, I love your other girls or guys. And sometimes dogs have a problem with guys. So you may have to say they really just do better with women. And same thing with your vet. And we all, we're professionals. We're not going to get our feelings hurt. And that's a good thing. Some
people tell me, they went to a certain vet office, they've been going for a year, and it's just like, we're just not getting along, and I'm like, it's okay, and I say, look for somebody else. You know what I'm saying?
And you can move around in that actual same practice because you may really enjoy the setup, and the front desk is amazing, and so much happens at the front desk, and those girls and guys are working so hard, and they really sometimes have the hardest job because they're communicating from the time the phone rings.
Absolutely.
But if you're not, if you're not getting the service, or you're just, and you've done everything, and you can talk to the office manager and do it in a way that's respectful and politeful, and then still you're not satisfied, time to move on.
Absolutely. All right, so we're talking about vet visits. Let's go ahead and talk about some of the vaccinations and preventatives that you would recommend for dogs across the board. Obviously, some of the most common ones people know about: rabies, bordetella, getting your heart guard, tick, flea prevention, that kind of stuff. Like, can you talk to us about which ones are the most important and why, why the pets need them?
And it's kind of right where I start at the beginning when I'm doing the history and understanding, get the records and let's know what your pet has had in the past. I recommend, of course, there's rabies, of course, is just part of what we call a core vaccine. And the other one would be your DHPP, distemper, hepatitis, parvo, parainfluenza, DHPP. And then sometimes you'll see lepto, which is another, probably more so we're doing lepto vaccinations and making it a combo. That one is still considered maybe still a non-core, depending on where you live.
What is lepto exactly?
Yeah, so leptospirosis, bacterial, and it can be in the environment, carried by things like raccoons, wildlife. Used to be something we worry more about when you lived on a farm, you lived out in the hunting dogs. Now we're seeing it in the city. And it comes in waves. Some years we'll see more cases and other years we don't.
A lot of raccoons in the city going through the trash,
And it's really hard. So we just kind of consider a lifestyle, I just say lifestyle evaluation. Because I have clients that travel and I have some that go up north for part of the year, come back down here. So we just had a German Shepherd that she was traveling up to New York and going to be there for three months. And so we went ahead and started her on a Lyme vaccine series. And every vet clinic's very different. Every individual vet can be somewhat different. Most of the practices probably establish a similar protocol to keep everyone on track and the way they train their staff. But through that lifestyle evaluation, that's really how we decide what vaccines your pet needs. And across the board, I always ask questions like, are you planning on traveling? Do you plan to board? Do you going to do doggy daycare or training, group training classes, grooming, because then the risks of these diseases kind of go up. And it also depends on the disease we're talking about. Like for Bordetella, which is now changed some names, canine, canine cough, canine upper respiratory infection, complex. So Bordetella being a bacterial is just one component, and we can treat that with antibiotics. Versus rabies, a virus that's deadly. There's no treatment. So that's kind of the difference between these core and non-core. And then in some areas, depending where you live, you may see more cases of, say, parvo in some of the rural areas, or maybe with areas that don't have great vet access. So we do, and we'll see that come and go. It's been a long time since I've seen a parvo case, but my clientele and the amount of pets I'm seeing, but across the board, I do think we're starting to really get a handle on some of these diseases. But just 10 years ago, I'd see 2 or 3 distemper cases, and fatality is really high. So usually my recommendations are definitely you go through the lifestyle, and then once you've figured out what the risks are, then we get into some breeds. There are certain breeds that we may avoid certain vaccinations, despite sometimes what the vaccine companies tell us. Like it is okay to vaccinate dachshunds for lepto. However, they are probably a breed that's a little more at risk of having a vaccine reaction. And if your dog has ever had vaccine reactions, then we kind of have a whole different conversation on which vaccines we really should be doing, how often. Some vets still have a 1-year vaccine program. Most vets are now adopted to a 3-year. That's a DHPP every 3 years, rabies every 3 year. Now, South Carolina state law states we have to have a 1 year before 3 year. And then thereafter, you can just go every 3 years. Bordetella kind of depends. The vets, it's once a year, but in some places, boarding and grooming facilities want it every 6 months. So we could go disagree, or go around and around about that. And then now some newer vaccines. So we mentioned lepto. That's a yearly vaccine. So, and then influenza. So we do see the flu. It started off when some of the greyhounds down in Florida suffered from severe pneumonia, and it was hemorrhagic, and they just died. And so again, it kind of comes back to very specific breeds. So like figured out greyhounds are super sensitive.
Yeah.
We had one case a couple years ago, which is what started this influenza recommendation, and it was up at a dog show. So, we expect outbreaks when you get that many dogs in an indoor environment.
Yeah.
So it's really great to partner with your vet and discuss your concerns. Some we can say we have validated in the science world, some is evidence-based medicine, and some is just kind of still theories.
Yeah.
The dogs that I really am careful about when it comes to vaccines are dogs that are not healthy. Vaccines have been studied in healthy pets. If your pet is super sick, we shouldn't be vaccinating your pet.
Yeah.
And we need to wait till the time is right, even if it's not convenient, because we want to do it all in one exam.
Yeah.
Or if your pet has had a history of cancer or has cancer. To me, those pets just, most of the time the oncologist said, we're gonna stop vaccinating at this point. So those
Focus
are
on the cancer, take care of that.
Yeah, and the immune system's altered, so what we think would normally happen with vaccines may not be happening.
Right.
There are vaccine failures. So, for instance, Rottweilers and Pits don't always produce the best response to parvo.
Really?
And we've shown that. So we know sometimes your vet will say, we're going to vaccinate this puppy 8, 12, 16, 20, and you may hear them want to go even further on these dogs that may not get the best response.
Yeah.
And then of course, if you have a puppy who didn't get any antibodies from mom, they're susceptible at 6 weeks. I mean, to these diseases. So that's really important. We don't want to over vaccinate and put any dog at harm for vaccine reactions or anything else, but vaccines are still critically important.
Absolutely.
And there are vaccine titers, so you can discuss that. I do have clients that choose to do a vaccine titer to show that vaccine actually has lasted.
Okay.
Rabies is kind of a different, because it's a legality issue.
Yeah.
But for some of these other ones, distemper parvo, you can do a titer.
Yeah.
I got 2 points on what you were saying. With the Bordetella, so the past I've been to 2 different vets since I've had my dogs. I've had my first pit bull for like 3 years, my other pit bull for 2, and I had her since she was a puppy. They seem to say when I go there and get the vaccinations, hey, if you want Bordetella, you can get it. If not, it's not a big deal.
Right.
Like that. So at first I was like, it's an extra expense, so I'm gonna go ahead and pass it. I just had them yearly vaccinated in May, so I got it then, and I just kind of do it now just in case. But at first for a new dog owner or someone who's just now stepped into I'm taking my dog to the vet, I don't know a single clue what's going on. It seems like when we're talking vaccinations and stuff like that, Bordetella, I don't know if this is like I really need this or not. Like they don't really explain to you. They're like, well, if they're going to be around other dogs, you need it. So it's like, okay, maybe sometimes, So it's like it's hard to read in between the lines.
It is.
And then my follow-up, or after you answer that, is did you do any research on the whole dogs can contract COVID? Now that you're saying they can contract influenza, it would make more sense. But I guess that was a theory, since there's a lot of research going on with COVID still. So.
And I will, so the first part is about Bordetella, and it's super confusing because we've changed the name, and understanding that Bordetella is it's a bacteria, not a virus. So we really can't, and then there's really the whole how effective is the vaccine itself. And this is important. Probably now with COVID, more people really actually understand vaccines better than we've ever understood them. But your pet is still going to get exposed to the bacteria. So once it enters in, let's say right through the nose and your respiratory system, then the body's going to start to generate that immune response. Well, it's going to generate a very strong immune response if we've vaccinated. And so what you may see is a dog who has very minor symptoms like a sniffle or occasional cough. And in about 7 to 10 days, it's done. A non-vaccinated dog may actually just develop a very severe cough. And then in puppies, Bordetella could actually become a pneumonia. So then we go from upper respiratory to lower respiratory. So it comes all the way back to, the evaluation of your pet, the lifestyle, where age, breed, and what's really going on right now with your pet to determine if they really are a good candidate for the vaccine. But for the most part, across the board, all dogs are good candidates for Bordetella.
Right.
And so it's still considered an optional vaccination. But I always say...
Do you think it should be optional, or do you think, hey, we need to get this done just to make sure everything's good?
I do typically recommend it to my clients. And if I have a dog that's like 12 years old and has never had Bordetella and has never had... I still discuss with them because, I had a recent case that just developed it and there was no exposure known, except they have another dog in the household, and that other dog probably ran around another dog, and that dog was vaccinated, but still was a carrier. No symptoms. But it's not considered a life-threatening infection, so that's where it always is going to be. But I would say when in doubt, it's probably better because of them being around other dogs and the exposure. So, and and then as far as COVID, so yes, they've already documented the dogs can get it. They're not much of a carrier. It doesn't seem to elicit any major disease. They even have testing for it in our major laboratories. And so it gets kind of and we have testing. Like, for instance, I know one of the vaccine companies will, for Bordetella, if you vaccinate and your dog, we suspect it has it, they'll actually help to pay for the testing.
Oh, really?
To prove it.
Yeah, because they're trying to figure it out. And
and what we find is sometimes we don't even find Bordetella organisms, we find all these other ones. In COVID, I haven't come across any pet that I've ever discussed testing, but it is available, and it is one of those situations that, since it seems to be a dead-end situation, they're not going to... But we do tell people to use all caution. Like, if you have it, it's probably best not to...
Absolutely.
Let your pet be right up in your face.
Just a common question. I'm sure other people are probably wondering the same thing out there.
It's scary, and we didn't know. I mean, now a little different in cats. They do seem to see a little more disease response in cats, and then the big cats, that's where they documented them actually becoming ill.
Now, like monthly preventatives, like Heart Guard, Brevecto, those types of things. What are you recommending as far as that? Obviously, we don't want heartworms, so Heart Guard are the equivalent to that. What do you recommend on a general basis? And like, I don't know if you want to talk about any specific brands that you have found to be better than others. It's a big topic, and we discuss it so much. It's like, we're so used to answering all the types of questions, and some people are very hesitant on using these medications because of the side effects, or some of the documented side effects. So heartworm is it's endemic in our area, and believe it or not, we get about 40% compliance. That's kind of one of the best sites to learn more about heartworm disease, and what they teach us is the Heartworm Animal Society. And they'll have like demographics and show you how prevalent it really is in our area. That's great.
And in different areas. And then after like Hurricane Katrina, when they relocated all the dogs all over the country, we started seeing heartworm disease pop up, and there was heartworm disease down in the Mississippi Valley that we were worried about some resistance. So that changed some things. So we kind of saw some new preventions come out that we thought were more effective. And now with all the generic heartworm medication, the list goes on and on. I typically recommend the all-in-one. So the one I'm using the most and almost exclusive, unless someone's already been on something and they don't want to change, is Simparica Trio. Heartworm, flea, intestinal parasite, and tick. All in one.
Really?
The only pets that I don't recommend that for would be a sick, debilitated pet. Or one that has had a history of seizures. So it's not that it necessarily makes your dog epileptic or cause seizures, but it seems to lower the threshold if your dog is already epileptic.
Okay, I see what you're saying.
We don't have a lot of safe anything in epileptic. We just doing the best we can.
Yeah.
So you would partner with your vet and discuss, because if you came in and you had a collie, I don't recommend HeartGuard because they have a gene that makes that ivermectin, they can actually be toxic to them and cause
Holy
them.
cow.
And they can test for that gene.
Yeah.
So a lot of clients that are into those herding working breeds, any white-footed dog is what we're told, you know, you need to be careful with ivermectin.
Yeah.
I would use something like Sentinel.
Okay.
So, you know, and Bravecto is your, kind of a newest one that was the flea and tick, and it's every 2 months.
Yeah.
And then I think at one point it was every 3, if I'm not
Every 3
mistaken.
is what it's at right now,
Yeah.
I'm pretty sure.
Cats they came out with one for cats, and it's every 2, and the dogs is every 3.
Okay. Yeah.
But yeah, so, and it's great. I mean, so I judge it based on, number one, compliance. So the first part is making sure my client's actually going to give what I recommend. And that it's based on cost, availability, and their pet. Will their pet take a chewable every single month and not go out and spit it out?
Yeah.
Or who wants to cram something down their throat, and a geriatric, someone that just can't do that.
Yeah.
So so sometimes I'll use topical. Advantage Multi, still a wonderful product. But what we've seen is flea control and to get tick control, and almost get even sometimes more than 30 days. That's amazing.
Yeah.
So compliance, and that's why I do the all-in-one.
Yeah.
Now I do recommend ProHeart in certain situations. That's the injectable.
Okay.
Then now we have an every 12. So I
they
just had a
can do
client
that
text
with
me about
you,
this
though.
today.
Yeah.
So
you'll do that at your appointment.
I do,
yeah.
and I just started carrying. The only reason I don't always have it readily available because it can expire on me.
Okay.
So I have to have enough
gotta use
dogs.
it. Yeah.
Otherwise, I just say, hey, go into your regular vet, get the shot.
Yeah.
We do have to follow a strict protocol. We do have to heartworm test at the time of giving that injection. We have to make sure they're negative. And then we give the injection. They're good for 12 months.
As far as compliance goes, that's probably like the most compliant,
So if I have
Way they're
someone that
knocking
is
it out.
spotty on their prevention and really for whatever reason, hey, no judgment. This is a great option.
Yeah.
Let's go ahead and try this.
Yeah.
And now you still have to worry about fleas and ticks. So people still have to keep
super
up.
important too.
Super important.
Those ticks will carry some crazy things, and
Yes.
fleas are annoying. Other than being annoying, do fleas pose other threats? Like what are they?
So they can pass on diseases. Like most common one would be like tapeworm in a dog.
Oh shoot! So that's when the dog eats the flea.
They eat
and
the
flea produces a tapeworm when it's inside.
Yes.
Right. Yeah.
And then and like in cats they can carry different diseases that basically make them anemic. And in people, cat scratch fever. So, which I actually had when I was a little girl.
Yeah.
And so super high fever, very big lymph node enlargement, hospitalization for a week.
Good Lord.
And so fleas are really nasty little critters, and don't forget about bubonic plague.
Oh yeah.
They carry that. From the flea to the rat.
Just a small one. Just a small disease. No big deal.
Yeah.
So
We don't want to go back to
they're
those.
way more than just annoying. All right. Good to go.
But I mean, we see it. Most common reason your dog comes in scratching, itching, and has hair loss is fleas.
Yeah.
Fleas until proven otherwise.
Yeah. We
Which is-
require flea treatment and tick treatment for all the
Yes.
dogs here. You know what I'm
Right.
saying? Like, we're not even going to play with that.
And
You know what I'm
ticks,
saying?
people think ticks fall down from the trees.
Oh, no,
they're just in the
everywhere.
brush.
Oh, yeah.
And they crawl up.
Yep. That's another
Not-
reason why we got the guineas. They're going to eat
Oh
the
yeah,
ticks,
smart. It's very smart, and they
Yeah.
are good at that.
Yeah. So, good to go. Do you have anything to add on that? I saw you getting ready. All
I'm
right.
good. I'm good.
One thing I wanted to talk about next was injuries in dogs. Now, I've heard, because one of my older dogs had both ACLs repaired, but I've heard that pit bulls are more susceptible to the ACL tearing because they're so muscular and they make quick movements. You know what I'm saying? So can you talk to us a little bit about injury, some of the most common injuries that you're seeing, what people can do to prevent injury
Sure.
in their dogs?
Yes, no, and it's ACL. Just if we talk about that one specifically,
Across
so
the board, that one's going to be the most
it can be
common.
pretty. I would say across the board. If they come in limping, and holding that leg up and won't put any weight. I've had some very stoic pets, and they can come in toe touching, and sometimes they start putting weight into it. But your classic They just can't. And it can happen acutely. They could be running across a yard and zigzag, hit a pothole, and you hear a yip, and that's it. There are some breeds where you may see more predisposition to it. Obviously, we worry about some genetic predisposition, just conformation, and even male versus female. So we may even see ACL tears more in female labs than we do males. I mean, we're talking not probably a huge percentage, but just something that we know. We are looking at those demographics to understand.
Right.
So probably the best prevention is to keep your pet at a lean body weight.
Good topic right there.
You go on and on.
Here we just open the book up for Chad.
Right. We'll say the two most common diseases we see is obesity and dental disease. And I diagnose it so often.
Yeah.
So when we see that, then we also know we've got a really hyper lab or pit bull. And you just can't keep them down. They're just all over the place running, and they're just, then they need to get the energy out.
Absolutely.
But they're not built for agility. They're not a border collie that's going to do agility.
Right.
So we throw that ball and we zigzag it, and that's, when it happens. But, yes, if you can keep them lean and trim, you'll prevent many of injuries.
Right.
Now, sometimes that's just not the case. And there are confirmations. So, I don't, with some of the orthopedics, that's where we do go through the first, make sure we diagnose it. And it's usually just on an orthopedic exam. We look for a drawer sign, we feel it, and we know.
Yeah.
And then the big debate is whether they actually need surgery or could they heal. But unfortunately, once an injury like that occurs, we know we've induced inflammation. So arthritis can develop no matter whether you do surgery or not. But what we do want to minimize is how much severe inflammation continues to bombard that joint.
Right.
And if the main reason to do surgery is because the knee is unstable, and it can remain unstable for months.
I mean, if that ACL tears, is it going to?
It can heal.
It can heal.
It can heal, but it's healing by scar tissue, and then the joint gets pretty angry, and so then you can get osteophytes, which is just bone depositing in the joint, which we know is not good.
Is there a degradation, like if the AC? And the reason why I'm asking is because I just recently tore my bicep. And they said you don't have to do surgery, but if you don't, you lose like 60 or 70% workability of that arm.
Right.
So if a dog tears their ACL and they don't do surgery, is there a percentage that they lose of workability of that leg?
They can. And what we see a lot, what I do see a lot, is a lot of straight-legged instead of that nice bend in the back legs. You'll see this dog looks like it's not bending.
Stiff-legging it. Yeah.
Stiff leg, almost like peg leg walk. And you're like, okay, so really I think that's sometimes what we start to do is try to recognize the symptoms as early as possible.
Right.
Sometimes that's not obvious to our clients, our owners. And of course, if they come in limping, it's an obvious thing. But and range of motion. So that's when you see your vet. This is where it gets tricky, because not every dog will let a vet do the good range of motion. So we don't always know. We have to work through that. Sometimes if we suspect we are dealing with a cruciate and we can't prove it on that physical, we're going to recommend a sedated orthopedic exam.
Yeah.
We take away all inhibition, and that way we can manipulate the joints.
Figure it out.
Yeah. And sometimes an x-ray, because if we suspect, it's not a cruciate, then we're going to want to look at what's going on in the bones. I can't tell you how many bony tumors we find in middle to older dogs or Rottweiler with a bone tumor up by the shoulder and it's limping.
Yeah.
So
that's crazy.
A physical exam is 3/4 of what is going to help us. By that time, we're almost 80% sure what the diagnosis is.
Yeah.
Then we just have to do a few more things to confirm it.
Yeah.
But injuries, I'd say ACL tears. I'll do patella luxations. Sometimes those go hand in hand. And the orthopedics can really, the specialists could probably weigh in, if, does that one cause the other? I mean, which one came first, chicken or the egg? It's a conformational issue. And some patella luxations need to be corrected surgically because of stability. And some dogs will leap and they pop that thing out. And I've had people go to the emergency room because their dog screamed, they yelped. and then they're holding up the leg.
Yeah.
And we don't know. It could be, patella or an ACL.
Yeah.
Other common things are just sprains. I mean, they can pull a muscle. There's a few muscles in the hip that they can pull that looks like they have hip dysplasia, but it's just the tiny little muscle that connects right, from the muscle to the pelvis, and that hurts, and it can take them weeks to recover. So oftentimes, if we think we're dealing with a hip injury, hip dysplasia, that's usually diagnosed by age of 2 in most large breed dogs.
Right.
Sometimes then an X-ray is warranted to kind of put everything to rest.
If you notice something funky with your dog, let them have some time off of that rough play or rough training.
That's
or
the hardest
doing,
part of the treatment.
Yeah.
And when we talk about surgery, sometimes just the whole, they're
It's
going to
hard.
have to rest.
It's hard, yeah.
But the reality is they have to rest anyway.
Yeah.
So,
Yeah.
but if 2 weeks, 3 weeks, 4 weeks of resting has not allowed this injury to heal, then, we know we're probably dealing with something that has to require some investigation.
Yeah.
And we use NSAIDs. Sometimes we see, my husband and I discussed this, we see vets or emergency room visits, and they're not sending home NSAIDs. It's a big component of pain relief. Not that we need to go into weeks or months of NSAID use, and that's nonsteroidal anti-inflammatories, such as carprofen. But those can provide pets great relief. And we're also talking about quality of life issues. So we want them to just not have pain, not so that they can go and just tear through and not feel any pain.
Right.
It's not that great of a pain med.
Right.
I've had people not want to give it because they're afraid their pet would be too active.
Okay.
But the reality is this is just something that you have to make sure they're not going to be active.
Yeah.
Give them pain relief. Sometimes icing can help.
I was going to ask
initial.
about icing. Yeah.
It's really hard to ice dogs.
Yeah. Yeah.
I'm going to give my client a gold star if they can do it.
Yeah.
But some pets are great.
Yeah.
And that's where some of the cold laser therapy that, a lot of vets have laser therapy available in their veterinary clinic. And there used to be a traveling vet that would go around and do it.
Yeah.
Very expensive little machines, but can be very effective in short-term and long-term injuries. And there's some different variabilities on the lasers out there and that you can do. But rest, slinging, and everything we can do to support that pet. Avoid stairs, just common sense.
A lot of that can be difficult to do,
A lot of it's difficult.
One of my, like I said, one of my older dogs went through, she tore one ACL.
Yes.
Got it repaired. And for those of you out there that haven't had an injury before, it's not cheap.
No.
So whenever you first get your dog, whether that be a puppy or an older dog, go ahead and have the financial discipline to set aside funds to prepare in the event that happens in the future.
And it's about a 50% chance it will happen in the
right.
other
So
knee.
then it happened to the other one within 8 weeks, which I think, I forgot who the doctor was. He was at the ER on Montague. I don't remember his name at the time, but he said, hey, 50-50 chance in within 8 weeks, the next one's going to go, boom, happened. It's holy cow. Yeah.
It is, and it's so unfortunate. Usually we warn people about within the year. About a year, you have that's about a 50% chance. And so, and other things I tell people is avoid, if you take them to the beach, maybe avoid throwing that ball because it's soft sand. They just don't have stability. It's like us being on the ball thing, it's just hard. If you throw the ball, maybe throw it straight.
Yeah.
And not too far where they get a little of that ball activity, like a lab. I mean, some of them you just can't stop throwing a ball. And so I've had people just keep doing it despite the recommendation, and it just prolongs.
Yeah, you got to think about not being in the moment. Think about your dog in the long term. Because some of those labs, they'll go all day.
They will
you
go
gotta
all
stop
day.
them. You know
all
what I'm saying?
Day. But yeah, so and then. There are some great companies that do, and so other injuries we do see is like back problems, intervertebral disc disease, dachshunds, or even larger breed dogs. We do have to worry about tumors in the spine of dogs. That's why sometimes we want to do imaging because this may not be a disc.
Yeah.
It could be a tumor. on the spine, which
Someone says, my dog jumped on the counter, they fell off, now they're limping.
Yeah.
You know, you probably hurt your back a little bit, you know, jumping on the counter.
And they can sprain it.
Yeah.
And usually within, 2 weeks, they're back up and completely normal. But a back injury, it kind of comes and goes. They can even be so painful that they don't want to move. They act like their abdomen. I've had some people go to the emergency room and they think that they have, a GI upset.
Oh, yeah.
But it actually turns out to be their back.
What about dehydration for like the summer? Do you see dogs that are like dehydrated because the owners forgot to put water out for them, or the dog has just been outside all day?
Yeah, absolutely. We do. Heat exhaustion, heat stroke. It's just unfortunate. It can happen, especially with specific breeds. I mean, brachycephalic breeds, your bulldog and your French bulldogs, your Boston Terriers, boxers, smaller breed dogs, even like the flat-faced Shih Tzus, Pekingese, they can easily overheat due to the fact, obviously they are only perspiring based on evaporation from panting. And so there's only so much heat that can be released that way. And then, yes, based on the outdoor temperatures, it's just the outdoor temperature itself that leads to that heat exhaustion. And so sometimes even having water won't always make a difference.
Okay.
So those are emergencies. And of course, veterinarians have seen, I saw a 107 temperature on a bulldog and went into a coma and never came out.
What is the what's the normal body temperature that a dog should be at? Well, I guess it depends per breed maybe, but
it's pretty much average across the board would be, we may see like 100 to 102.5. Now I have had a few really excited dogs come in and they're at 104.
Really?
And they're not sick. They just came in and they're crazy hyper and panting, and we let them cool off, give them some water, recheck the temperature, it starts coming down. They're not sick.
104 is starting to get to that high range, right? Yeah.
But that's where some of them just get that much anxiety being in the exam room. So, or getting in the car and all of it that leads up to getting, so it really is advisable during this time of the year. If you can keep your pets indoors, that's the best recommendation. Absolutely provide shade, fans. I've had people do all kinds of things to, provide that.
I was about to say fans
cooling.
to move the air away from the dog, right?
Yeah. And sometimes people shave their dogs thinking that's going to cool them off, but that's kind of a myth. Their hair coat will help to actually keep them cooler in the summer. And
what about dumping water? Some people are like, dump water on your dog.
Anything to bring their temperature down. I think it would help. And we've done that where we've had to put ice packs on them when they come in. But we have to be careful about how quickly in a heat exhaustion or heat stroke situation, we're doing IV fluids and everything because they go into shock. Right. And so we have to get that temperature down. But and the car is it's a heartbreaking situation, and we've had people actually have to call the police. You hear stories of break the window themselves to get the dog out. And people think it doesn't take, but that cracking of the window is not going to work.
Dude, before you do that, you sit in your car, turn it off, crack your window, and how long can you sit in there?
Right.
Legit do that. It's very fast.
Yeah.
Even in the shade, it's extremely fast.
Those are just some things, and we just don't think about sometimes, particularly when we running around doing all of our trips and want to take our dog with us, but just be aware of that.
Leave the car running.
That's it.
Leave the AC going. Or the Teslas, I heard they had like a dog mode.
Oh.
I don't know if you've heard about that.
No.
Because it's electric. They have like a button you push. Boom, it's like dog mode. It puts up something on the screen that says, AC is running so people don't break the window. It's in dog mode. The dog's in there chilling.
Yeah. That's cool, awesome. That's really cool. And I know down in Kiowa, they have these little devices that you can put them in and you pay. It's like a little tube.
Oh, really?
And
it goes in your car?
No, it's outside in the shopping area.
Oh.
And you put your dog in, and it has air conditioning, and you pay for it when you go inside the store.
Oh, really?
So I thought that was really
That's cool.
Yeah. To keep them so you can, because so many people do want to take their pets with you.
Absolutely.
on a side note about the heat, people don't think about it, but walking your dog on the side.
I was going to ask that next.
Oh gosh,
burning the paw pads. I've seen that before.
It's horrible. Yeah, and we've seen it just take the whole pad right off. So very painful, and dogs don't always even know it's happening till it's already happened.
Well, what do you say to like test for that? What's your test? Is it the hand on the pavement thing?
It is. You can just feel it and know if it's too hot, but probably when the temperatures are what they are now and 90 and above, it's just, I just say, or early morning, late evening. I mean, I've had some people that just end up having to almost walk at dark if they have a highly high risk breed of overheating.
Right.
So it's a tough decision. You want them to enjoy life, but just set yourself up. If you don't have shade, you probably don't want to be bringing your dogs, out to that event.
Could you explain the importance of protecting those paw pads to maybe people who just don't fully understand, maybe even have dogs, what the role of the paw pad plays for the dog, and when you're blistering it up or rubbing it raw? What
so I mean, it just
have?
basically ulcerates that, and that pad is keratinized skin. It's almost like what our nails are made of, and so it doesn't heal well. It doesn't really just regrow skin, although it will, but it's more like scarring. I can't say I've ever seen one so severe that they wouldn't be able to regain function, but definitely. And then we have to bandage and put padding, but I mean, that's just their way of padding their walking, and so and most of the time if it's that big carpal pad right there in the center that they're putting all their weight. But there are certain toes they bear more weight, so you may see it on certain pads and not others, just the way they weight bear. Right. And but very painful, takes a while to heal, and they may not notice it until it's already done the damage.
What about the people that are like hanging out in their backyard with their dog? It's kind of warm outside, and they're like, I want to cool off my dog. Maybe the dog's not like overheated or anything. They're just like, I want you to be cool, right? Yeah. To the best extent possible. Is it better to let that dog's coat do the cooling for the dog, or to soak that dog with water? Yeah. You know what I'm saying? That pretty much inhibits the coat from doing its job based on my thought process.
If the water's cool enough, like I do think like having baby pools and providing fresh cool water will keep their temperature down.
We know that Toby and Rudy love the baby pools now.
That's right. It's great. I mean, it's just great enrichment for them and getting them used to water too at an early age if you have a young puppy. Just that sheer heat coming down on them, that's the shade is going to be the key. Okay. That I would say. And then, and some dogs, some do need a haircut just because if their hair is matted. Oh yeah. We've got a miserable dog that has mats. You probably should.
Well, let's talk about that real quick. Matted hair. That's actually when it gets to the point of the skin, it actually inhibits the blood travel along the skin. Correct. So if
it's
someone's
painful.
Not taking care of the coat, they got to shave that off. You have to shave the whole thing off.
Yeah, I mean, certain mats become so severe, and we see that. I see this more in small breed dogs than I would large breeds. But I've had some that I've had to go in and just shave. I couldn't even reach like the vein on the leg because it was just one big mat. Yeah. And then around the face is probably the most critical area because the hair gets matted, the hair's in the eyes, it's rubbing the cornea. Sometimes, dogs are dealing with ear hair and all of that needs to be dealt with because they're getting water down the ear and they get ear. Around the feet can be, touchy for them. Yeah. So probably, if you have a breed that is going to need, like you have Dobermans, you don't have a groomer, but, but other breeds, it's great to get the groomer on board as early as possible. So the new designer breeds, Labradoodles and Golden Doodles, it's an art to grooming them. And I've seen some really bad grooming jobs just because I think it's really hard to know how their hair is going to take it. Yeah. Some turn out to look like labs, turn out to look like poodles. Yep. And
but even between grooms, the owners, you guys need to be brushing those dogs out.
Absolutely.
So if you're getting one of these dogs, understand you got to brush them like every day or so,
Yeah, and getting them used to being handled, and then also the same thing applies. They get used to one groomer, and if you're seeing that same person month, every 2 months, every 3 months, then they're going to get used to that person touching their feet and doing a shave down if necessary, if they get too matted. But, and just having them used to, nails trim, that's another,
we're training that all the time. Let's say we're rehabilitating that all the time.
Yes.
Most dogs want to eat you whenever you try to trim their nails,
Yes. And I do a lot of nail trims that I'm shocked that I can do in the home setting.
Yeah.
And sometimes you just have to start slow, and if you can just do one paw at a time and move on, I usually try to get them to stand and not be like WrestleMania.
Yeah.
Some you end up having to if the nail's growing in.
I can see you body slamming a dog and I'm going to get this nail.
Yeah. It's like, do whatever. I have had some situations I'm like, okay, we're like rolling around on the floor just to get it done. But a lot of it's just taking the time and trying not to stress them. The biggest technique is owner gets some peanut butter. I mean, I've done cream cheese, peanut butter, or whatever it takes on a spoon. And even if they're muzzled, I do the Baskerville muzzles and rub that in the inside of it and let them just lick. And then we just trim. And it may take a little bit of extra help, but most of the time we can get it done. So.
Desensitizing to the nail clipping. Good to go. Yeah.
Oh, yeah.
It's a process, but you got to trust the process. You got to take time. And you need to be working with someone like yourself or a groomer or whoever that's willing to take the time instead of being that hustle and bustle, quick in and out. Let's just get it done. Like you got to take the time to get the proper repetitions in. Right. Because we're thinking about long-term behavior.
Yes.
What's going to make it the best experience for that dog.
Exactly. A positive experience. And not every owner feels comfortable. And your dog knows that. They pick up on that hesitation and that fear. And then maybe it is best to just go ahead and have. And there are people that'll come and just do nail trims in the home. Yeah. So we have now more access to that than we did before, where it had to go to the groomer, had to go to the vet.
Yeah.
But yeah.
We try to train a lot of our owners to do that at home, with like a Dremel or one of those clips,
Absolutely. The Dremel's
help
great.
Help them be comfortable with it, help the dog be comfortable with it,
Yeah.
Because let's talk about nails real quick. Like what happens if those nails get too long?
Oh, yeah.
That dog's like, you see the dogs in pain when they're walking.
Yes.
And they got the super lump. Maybe it's kind of curling up to the paw. I've seen one even in the paw pad before.
Yeah. We get it a lot, and I've seen it in cats and dogs, and when you hear them tapping, and they're literally walking on the nails, and they're slipping and sliding, and it's important. We all have hardwood floors, and it's great to really provide proper traction,
right?
Because the nails can't do it on hardwoods. You can try walking them to wear them down a little bit, but once they start, you just want about every 8 weeks, I would say, is a good rule of thumb for nail trimming. Some may need it a little more often. Some you can go.
Are there any like skeletal impacts to like the feet if the nails are not trimmed?
I don't know that I've seen it. I haven't seen it, but I have seen arthritis in the paws and so there you can tell their nails are sitting off to the side, which then means it's abnormal wear and tear.
Right.
So sometimes that'll tell us, or if I have a dog that has like neuropathy, the opposite happens. Their back nails get worn down to the nub. So there's nothing to trim, and that's usually a sign they've been dragging. So we investigate into this is something neurological or arthritic and pain.
Gotcha.
Do you recommend, if the nails are to an extreme length, do you recommend, hey, just cut the whole nail right now, or do you just let's grind them?
I know.
Is there a process
I don't
that you
do
prefer?
I don't do the dremeling, but so I just do the usually my nail trimmer. But their quicks can outgrow. That's why it's important to maintain them as much as you can. That keeps that quick shorter and shorter, and that's how you see some dogs. So how do they have such short nails? But they've been working on those every some once a month. But and if we do have to cut it, I mean it's gonna bleed, and we use things like quick stop, and it can be so painful. I've had to sedate dogs when that nail or they split. That's another injury we see. I had this schnauzer that used to like try to tree squirrels and it would come in every couple of months and a split nail, and we knew what he was doing, and we'd have to just sedate him. And that's a good time if you do have to sedate, like if you're having dog's having a procedure,
get it all done,
dental. Yes. And then they can I don't advise lasering. We used to do some of that, and that's where you would basically you're cauterizing, but you have to be careful about infection.
What about if the nail splits? I've seen this a couple times, and the
Yes.
quick is like hanging out.
Yes.
You know?
Yes.
I had that with my pit bull. Had
a hemostat, and we grab it and we have to yank.
Oh, shoot.
But I would sedate them if
Yeah.
it's not just barely dangling, because I know the pain is already pretty severe.
Yeah.
I've had some where it's
So you can just rip it out.
We just have to. It's like the shell of it's the shell of the nail, and then what's left is just your meat and
Right.
cuticle. And most of them will heal. Sometimes the nail will grow a little funny.
Yeah.
If it goes way far back, but yeah.
That's crazy.
I know. So it's, and you could be a diligent nail trimmer, and that
Yeah.
can happen to the best. They get them caught sometimes in the wood
Yeah.
slats on
Yeah.
the back porch or something. So
Yeah, my pit bull ripped her dew claw. That way she had cracked the
Yes.
nail or something, and the quick was exposed,
dew
and I had to get her
claws.
the.
And I did learn, dew claws are important for agility, especially when you have dogs that are, when you think about how their feet are spread apart,
out,
and that
yeah.
helps with certain balance. Now, dew claws in the back, we really just mostly advise people to remove those.
Yeah.
Because they're usually dangling, and you could get them. They can get them caught in
Yeah,
the
they get
kennel.
hung up on things all the
So
time.
yeah.
All right, let's talk about supplements real quick. What supplements have you found to be most effective? What do you recommend? It could be for a young dog, could be for an older dog,
Yeah.
like joint supplements, other types of supplements.
Yeah, we live in the supplement world
Yeah.
now.
Yeah.
And, so we call them nutraceuticals. And the problem with this is that they're not very well regulated. So you and I could come up with our formulation, and we could make our own joint supplement for dogs if we, can get the formulation right, that type of thing. So we have to be very careful, and everyone's out there to sell you something. So I always tell people, start with your veterinarian and get those recommendations down to the specific brand. And we have our reasons why we sometimes recommend the $40 glucosamine chondroitin versus the $10 that you could get, at Walmart. And some things are just not made with wholesome ingredients, and they're not even true to the label. So you can go and research that on your own. There are a couple different websites that will rate nutraceuticals and from person or dog or whatever. But probably my top would be glucosamine chondroitin. We now have them enhanced. So oftentimes you have MSM, we have green lip mussels that you find in like Dosaquin.
Yep.
Dosaquin Advanced, everyone has come out with an advanced version. Cosaquin was like the first one we had, which is over the counter. And sometimes I'll start people with that first if I have maybe the beginning and the early stages. Then, so glucosamine, and then I'll use things like, I use a company called Standard Process, which is not readily available online, but they do take whole food supplements and grind it into one's called Canine Whole Body Support.
Oh.
I got turned on by Dr. Ruth Roberts to these supplements, and she used them in her practice, which she practiced more holistic.
Yeah.
And so then I investigated it, and it was like, yeah, this is great.
What's that? What's the name of that again?
Like Standard Process, they
Standard
make it
Process.
called like whole canine support.
Yeah.
They make whole line of. They make Mobile Flex. They make glucosamine, and then sometimes down to specific conditions that I would say would probably be recommended if your dog has certain ailments. But yeah, there's a bunch of different options out there. And I would probably say there's 10 companies that are making different joint supplements right now. But the idea is you're trying to maintain that healthy cartilage, and you're giving it everything it needs to maintain that. The other thing would be like Adequan or Adequan. That's an injectable.
Okay.
And so I just started an older dog on it, which we had talked about starting it for a while.
This is for joints or something
This
else?
is for joints.
Okay.
So basically, it's very similar to glucosamine. They use it in horses, but you give it as an injectable. Usually your vet will give the first injections, and then you go home and give it to yourself.
Okay.
So pretty easy for clients to do, but the earlier we get these joint supplements on board in the process of whatever the injury is, whether we're treating a acute injury or chronic injury, the better response we're going to get. I start kind of adding on from there. I never rely on joint supplements alone for inflammation. I'm always going to add on a non-steroidal to particularly catch up with the acute pain.
Right.
What we don't want to see is we get into a wind-up pain situation, and people experience this. You get in so much pain, nothing you give touches the pain, and it just takes time.
Yeah.
So we wanna intervene sooner than later. I also use a lot of probiotics. So probably most common thing we see dogs for: vomiting, diarrhea. So use a lot of supplements. Kind of gets us into nutritional supplements and probiotics. We're in this world of probiotics, and I'm kind of fascinated by it, and I'm always recommending it, whether I have a dog that's going on antibiotics and we want to do a probiotic to maintain healthy GI flora, or we're doing probiotics for dogs that have chronic GI ailments. So we're seeing a lot of benefits. Even now they're talking about probiotics and the communication with the brain. So for cognitive dysfunction, we're entering in that world. Any other specific supplements? I know I do get asked about CBD a lot.
Well, I was going to ask about CBD, but before CBD, two things that have been popping up recently, or they've been popping up the past couple of years. You already talked about green lip mussel, and sea cucumber.
Yeah.
What are your two takes on those two?
I don't know much.
Is it good to throw them in there, or is it kind of like one of those things we don't know a lot about it yet?
I can't say much about that, but it's you're saying the seeds of the cucumber.
Sea cucumber.
Oh, sea cucumber.
Yeah, like SEA cucumber, like a cucumber
Seaweed.
that's from the ocean.
Yes. Okay.
Yeah.
So I've had some clients ask me about that, and the jury's kind of like, some vets say yes. It's a little more evidence-based medicine.
Yeah. Don't
think we have any harm caused by doing it.
Yeah.
The question is it really beneficial? And so I think the jury's a little still out on that. But probably you're not going to cause any harm.
Yeah.
You have to be a little careful. I mean, we are talking about some of these have medicinal purposes. Probably most common side effect would be like vomiting or diarrhea. So, just kind of make sure you're aware that you're watching for that, or inappetence, or some pets just sniff out and they don't want to eat it, and it's a hassle. So the green lip mussels, that's kind of you'll find that in various supplements that they're adding that in.
Right.
Turmeric, curcumin. Curcumin is truly the medicinal component of it. I do think there's benefit. So if you're buying a supplement that has it, then we have to get into, is it enough?
Okay.
Sometimes I'll recommend maybe even individually supplementing if we just can't find something that's really good at has everything at once, and then trying to start things slowly and just see the results before we just hit them with everything.
No, it's for sure.
I'm trying to think of any other supplements.
Is most of these supplements, well, the first one that you had mentioned, the standard process, is that for, because after the other supplements you start talking about after that were normally for a situation if your dog is dealing with this, or if they're in some sort of state where they need assistance from a supplement. Is the standard process just a overall, let's keep your dog healthy, you can give it to them anytime?
It is.
Is there an age limit, like start after this age, or you can do it anytime?
And I think a lot of when I got into using it is when I had clients that are doing home cooked meals. And so if we were formulating that, we really have to add in
supplements in there.
We do. And so we try to do everything we can to get it from the Whole Foods, but not always. And there's some other companies, like not every vet is probably going to carry it. So they may carry VetraScience, which is another big brand, and some of those you can find online. And you start somewhere. Start with probably what your vet recommends, and then if you don't, see what the next option is. And making sure people can get access to it. So if somebody really wants to order, then I can set them up with an account and they can order directly from the company. But they still have to go through a provider. But the level of supplements, you just want to make sure you're getting what you think you're getting. And we're still learning. We're navigating through nutraceuticals. It's but I do think we see benefit. Start early, and you can, if nutrition, I know I get that's probably the third biggest topic. What should I feed my dog? Oh my word, that's a whole nother consultation, but we have to address it, and it's so key. And I think we haven't figured out the answer to that very well in our profession. And many vets just skim over it and tell you to go get this brand or that brand, and they don't go into the specifics. But once we get into dogs that have diseases and ailments, we do have to kind of get very specific.
Right.
But it's hard because not all dogs want to eat the same thing.
Yeah.
I advocate home cooked meals as long as people are committed to doing it and following, a guideline on that. But there are some better companies than others, and you do have to kind of research that out and make sure you're feeling good about what you're purchasing. And
you have 2 or 3 companies off the top of your head. You're like, this food's pretty good.
Yeah, I use. I probably do. My fallback probably would be Royal Canin. I have used them on and off for however many years now, 16 more.
Yeah.
Purina still makes Purina. They're veterinary. Some of their veterinary diets are excellent.
Yeah.
A little hesitant on the science diet since that big recall they had. I never was a big fan. They're fine if you are feeding that. Don't freak out.
Yeah.
It's just, it comes down to some preference.
Yeah.
But yeah, now some of the newer ones like the Farmer's Dog, and I think those are all coming back to this wholesome ingredients. You do want to partner with your vet and make sure you've chosen the right one. Because again, it's a lot of marketing, grain free, all of that. Well, that we can talk about that in itself, because some of that has been marketing myths that we've sold to the public.
Right.
And now what we're backpedaling going, well, most vets always said we don't really know, but now we know, like, we could be causing harm. And some dogs have developed cardiac diseases and things because we don't have it properly formulated, because some grains we need it. But I know there's a lot of worrisome about too much corn and this. And and I do think when you look at the way the foods are formulated and think about how they're processed, and we lose a lot of value. So I tend to have to fall back on recommending the best that I can. But I do think we're probably going to see in the future going to whole food, making our own food, supplementing them. And so that some vets are very comfortable with making those. Some will refer you to a nutritionist to try to get it better formulated.
Right. Absolutely. I think the whole food thing is great too, because like if you think about, dogs are living, breathing beings like us. We, our diet should be primarily whole food too. Yeah. So instead of, having a specific thing all the time, like change that up, get some whole food, make sure we're getting all that nutrition in there, so on and so forth,
Rotating the proteins. And you can start simple by just offering things like vegetables to your dog. The one I follow is Dr. Roberts' Crock Pet diet. And I just kind of, she used her formulation, and then just if I have someone that wants to start somewhere, that's where I start.
Yeah.
And go from there.
Have you ever recommended any of your clients, since you do the home cooked, the raw diet?
I don't get into raw. My concerns are a lot about handling raw food and feeding that, even though I do believe that, yes, if we thought about what canines are going to, keeping it simple and not cooking, you lose some ingredients, but you also deal with our agricultural system and our farming system. And so you probably have to be very careful about where you're getting your meats.
Yeah.
And then we do document salmonella being passed in the stool.
Yeah.
And so we live so closely with our dogs.
Yeah.
We're not just in this bubble where dogs are separated and we never contact their stool. And
or we should be picking it up.
We should be picking it up. But I just always have to say it's not my area, but I will do the best I can to advise people. And I do see dogs that are on raw diets and they seem to be doing fine. Yeah. So it's kind of a lot based on trial and error.
I was going to say, it sounds like in the common medicine world that a lot of it's still being researched.
It is, and it's just down to the question is what are we trying to achieve? Is it we're trying to prevent disease, or we're just trying to improve quality of life? The home cooked diets, dogs do maintain better weights. It's been my experience; they don't become overweight. So that tells me right away that something's not right with how we're forming. And typically, people are just overfeeding. Yeah. So portion control is the key.
I'm sure portion control and exercise are probably the
Talking about weight real quick, is there a good visual? Someone looks at their dog.
Yeah.
Is there a good visual to tell, I need to cut some food, I need to add some food based on the appearance of their dog?
It is. You can pull up the body condition charts online and look, and most of the scales is 1 out of 9, and 1 being cachectic and 9 being obese.
Right.
And I use my hand kind of as an option
of
looking. If you feel here, you're feeling on the ribs, and if you feel here and you don't feel ribs, we're overweight. You know.
Yeah.
Obviously, if we're feeling the knuckles, perhaps underweight unless we're a certain breed that stays very thin, like a Greyhound or Beasla.
Right.
But we want to kind of feel the ribs like we do our fingers.
Okay.
Below the knuckles, and that tells us, we have a pretty good body. That's one, and then look for the hourglass figure from the top, and then from the side we want an abdominal tuck. Yeah. And most vets come in with the chart and show you where your dog is, and it's because a number just doesn't mean anything to most people. It's the vision of what my dog is, and weight. We do just putting them on the scale, knowing. But if they are building muscle, then that's okay. But use the body condition scoring to kind of judge if that weight is.
This is probably more of a society problem, because society, as a whole, we're eating probably too much food, too much of the wrong food. Right. We want our dog, I need more food. My dog needs more. My dog looks skinny when actually it looks healthy.
Right. Comparing to the average
issue
pet.
Too, you know what I'm saying? But
it is. And we get used to seeing our pet looking a certain way. So we don't notice the changes. And yes, I don't advise free feeding. I always advise meal feeding. And 2 meals a day. It's fine. Or you do want to do 3. Yeah. Some people still just do 1 meal a day. Just as long as you're able to monitor that and maintain. And I think feeding is important. It's all about being on a schedule with your dog and knowing they know what to expect, when to expect it, and just stay with that. But if you leave food out all the time, it's very hard for them to associate us with feeding. I mean, I know maybe there's different reasons not to do that if you have certain behavioral issues, but, we want them to know, and this is a reward and this is bonding. Right, so absolutely. I usually want to recommend that.
100%. Yeah. And we have some people too we work with, and they're like, they know their dog needs to lose weight. They're like, I just can't. I have to give them the table scrap, or I have to give them more food. Right. And it's like, we'll do the weight loss program for you, but once we get your dog down to a certain weight, you have to maintain that. Yes. You know what I'm saying? You can't go back to your old habits of just giving them roast beef off the table every night. Right. You know what I'm saying? So.
And I tell people just to kind of put a little baggie together with, either vegetables, carrots. I don't advise feeding from the table ever. Yeah. Because I think you just can't. You're setting yourself up for failure. Right. Absolutely. So set yourself up for success from the beginning. And we always end up sometimes kenneling our pet, and eventually she gives up. But sometimes you just can't help it. But if you were, then you could have that set aside treat bag with the amount that you said for the day, whether you give it to them all at once or throughout the day.
Absolutely.
But carrots are great treats. You can cook vegetables too if they don't like them raw. Sometimes just morsels of their dog food. They don't really care sometimes what they get, as long as it's coming from us. Right. They do consider, but maybe not on the night you're cooking steak or something.
Absolutely.
They're going to know.
And if you are going to give them a table scrap, probably better just to go walk over to their food bowl, wherever you have it, put it in there, versus just hand it off the table.
Well, they used to tell us like 1 piece of cheese would be equal to like a cheeseburger. Compared to the amount of calories that they need versus what they're expending. And I do think that varies, but they don't need near as much food. Most of our dogs are living a very sedentary life.
Right. I mean, absolutely.
So that's that's a challenge.
Well, give us a skinny on CBD real quick if you can.
Oh yeah. So the official, I guess the official skinny is really, I can't really tell anyone. Yeah. That they should start CBD. Yeah. I think the AVMA tells us that we're restricted. We should tell people to do their own research, that we're not able to prove that it's truly safe for dogs. Yeah. But that and that's state to state, depending on the laws of that state. But there are companies like I've recommended Elevet, and once a client opens the door, then I kind of make sure I'm guiding them
Right.
to choose the best CBD. Like, do not go to that store on the side street
Yeah.
and buy CBD, or give them what you think are human products and their equivalent. You know, we can advise you, but without like directly saying, here's the prescription, or, hey,
Right.
you know, this is what, and I'm sure there are many vets that, you know, are loose about this in this state, and
Yeah.
I'm pretty loose about it.
Yeah.
But, yeah, so I do think there's studies, and you can look those up, but Cornell partnered with this company called Elevet, and they showed that it does help with dogs with anxiety, and they did a double-blinded placebo study. So, you know, we take all of that guessing out of it. There are looking at further studies like with anxiety, and some of the formulations are formulating it to help with anxiety. And that could be anxiety with, you know, people, other dogs, thunderstorms, noise,
Right.
for any of that.
Yeah.
And then third area would be seizures. So they're kind of doing studies to show that they do think. But cannabinoids, you know, I've gone a couple classes, there's over 100 different cannabinoids. The potency of the THC is like 10 times in the dog what it is for us. So it's
Holy
toxic
smoke.
to the liver.
Yeah.
So just a tiny bit,
Wow.
and any vet has seen,
Yeah.
you know, marijuana toxicity.
Yeah.
Any tiny little bit can cause severe symptoms and even death in a dog. So it's absolutely important not to think that we can just give them,
Right.
you know, a plant.
Right. Oh yeah. Oh yeah.
The THC, and not all companies actually do the studies to make sure they're minimize the THC in the individual, medicine. So that's important to know. Like the one company, Elevate, I think checks for 5 or 6 different types of the levels of toxicity.
Yeah.
And they
Yeah.
pick specific plants
Yeah.
out of those 100, because they're not all made the same. So I went to a couple classes. Those were some of my takeaways. And when I have a pet that we've exhausted some of the measures of treatment, whether like chronic arthritis, anxiety, just overall well-being,
Yeah.
I've definitely not been opposed to someone trying it.
Right.
As long as, you know, and just come to us and talk to us, even if we can't
Yeah.
be as directly as involved as we'd like to be with it. It's going to happen. I mean,
Yeah,
it's just a
yeah.
matter of laws and changes that come. But
Absolutely.
but yeah, always seek out some guidance.
Yeah. Absolutely.
And most of those companies will work with you directly.
Yeah, make
It's
sure you're getting
expensive
the
too.
legit
Like a
one.
bottle of the oil, like $150.
Yeah.
So you know, but you're getting, you know, you're going to get what you pay for.
Right. Right.
So that's a big key.
Don't go cheap with it. You got to make sure you're going.
Getting the quality and
Right.
make sure they have the quality controls. Like I had someone tell me that someone's making it and they make the pet, and I don't know what their standards are, what
Yeah.
their quality control is. And so we don't want to put toxins in our bodies, and definitely not in our dogs. And they're more sensitive to some of these toxins than we are. So,
Absolutely.
So yeah, that's the key. But the THC it can be highly toxic to
Yeah.
them. So
Gotcha. All right. One last question is kind of maybe difficult to talk about from the vet perspective based on, you know, vet world, you know, opinion on this, but neutering and spaying.
right.
You know, my experience, a lot of vets want you to spay or neuter your dog because, you know, is my understanding, they're trying to reduce, you know, accidental litters, things like that.
Right.
Can you talk to us about neutering and spaying?
Yeah.
You know, what are the long-term benefits? Because like those are controlling a lot of the hormones in the body.
Sure.
You know, long-term life impacts, short-term life impacts. What are the risks either way? You
Right.
know, all considerations with those types of things.
Yeah, I know it's an interesting topic, and I always retouch on this to see what new information comes out. So my recommendation now, they have come out with some guidelines, even down to even specific breeds, which I don't know those right off, and they have a nice little chart we can advise on.
Right.
But it used to be that we would recommend right around 4 to 6 months of age to get them spayed and neutered.
Right.
In the shelters, you know, that's a whole different
Right.
topic, but they are doing it much, much earlier.
Oh yeah.
And we do see positive benefits and negative benefits. So it's always kind of outweighing what we're looking for in the long term.
Right.
Across the board now, I recommend usually number one if it's a large breed dog, I want them to fully grow. So that means for a female, they're going to likely go through one heat cycle. We don't really have all the studies to show with each breed, and even sometimes going past, sometimes they kind of cut it off at a certain age. We maybe don't get into even the later senior geriatric years.
Right.
That information is coming, and over in Europe, spays and neuters it's very different.
Right.
And so we do know it affects the hormones. And so what we do start to know now, and I looked up a little bit about the small breeds versus large breeds. We don't seem to see any difference in the things that we're worried about, joint disease like hip dysplasia, elbow, certain cancers, certain things. We don't see an issue with small breed dogs like we do large breed.
Okay.
And then when I looked at the chart, I saw that there were very specific breeds that they recommended even sometimes waiting to 23 months. So, for German Shepherd.
Yeah, I was gonna say whenever you said
just kind of an example.
As they grow, you said a female go through one heat cycle. What would you say that's gonna be 2 years, 3 years? What's your age range to reach full growth?
So with most breeds, it is different, but usually with your small breeds, they're probably gonna be pretty much fully grown. Definitely by a year.
Right.
The large breeds, you could kind of go ahead and carry that on into 18 months.
Yeah.
And then our giant breeds, go right on past to 2 years.
Okay.
So, interesting, like they said, Great Danes, they didn't really push to the 23 months. They said Great Danes around a year. I wouldn't have guessed that. So it is a little bit, we're still navigating through the breeds.
Yeah.
They did, one I saw that it was a Boston Terrier that you wanted to wait till much later. So that's kind of new. I feel like a lot of that's new information we're getting specifically. But what we do know is that we do see a higher incidence of cases, and this is when they're looking at thousands of dogs.
Yeah.
Saying, okay, what are we seeing? Are we seeing an increased risk of cancer? And then if so, which cancers?
Yeah.
So for instance, golden retrievers, and we're talking a percentage difference between, say, intact golden retriever, even male versus female. I don't think many of us vets are going to be able to know that without pulling some research up. But we are seeing there could be an association with a golden retriever that was spayed or neutered at 4 months, 6 months versus waiting till a year. In maybe saying 18% of those could develop lymphoma versus the intact 5%.
Wow.
And some of those have been statistically shown to be statistically proven.
Yeah.
So that's important to know that. So the concern is we're seeing increased in certain joint diseases, hip dysplasia, elbow dysplasia, ACL tears, obesity, incontinence, urinary incontinence, and then down to certain types of cancer, lymphoma. The ones that were listed: lymphoma, mast cell tumor, hemangiosarcoma. All very bad.
Yeah.
The big, bad, and the ugly. So when we see that, it is important to understand that probably not way to know, really. What's going to really be. But there are genetic mapping. People are getting into that with the breeding. Unfortunately, a lot of this is genetically based. So we've got environment, we've got the genetics. How's the environment manipulating? How are these things that we're doing, like spay, neuter, medications, all these vaccines, all these things affecting these pets in the long haul? But I would say we are changing what we're recommending. It's not recommended to spay them at 4 months.
Right.
Some you're probably okay to spay at 6 months.
Right.
Some you're okay to spay at a year. Some 18 months. Some 23 months. And so I think those are probably pretty easy guidelines to figure out where does your pet fall. Now there's some benefits. You already mentioned reducing the pet population.
Right.
So I I make my recommendations very individually based.
Yeah.
So if I have a client that I know is going to be a responsible pet owner, I'm going to recommend that we have a lot of leeway here. Mm-hmm. What do you feel comfortable doing? And here's the evidence-based medicine that I can present.
Right.
But some clients cannot handle going through a heat cycle. They're not set up. Their pet could get pregnant, and we're in a lot of trouble.
Yeah.
So it's a judgment call, but it's also we don't want to do any harm.
Mm-hmm.
And so, and then we do worry about pyometra and mammary cancer, and of course testicular cancer and prostatic disease.
Yeah.
If I have a male that stays intact long enough, you can bet money if he lives long enough, he's going to probably develop prostatic disease. The risk goes really high up there.
Really?
Then we're looking at neutering a 12-year-old German Shepherd.
Mm-hmm.
Not a good situation to be in.
Right.
However, if they're predisposed to joint disease and we've just improved their quality of life by preventing them from actually developing hip dysplasia, which is in their lineage,
right,
then I think we probably did the best we could by that breed. So it is, you partner with your vet and make sure you pick their brain and try to make the best decision possible.
Yeah.
But we do know the hormones that are circulating because we've removed the reproductive organs are going to have some effects, and we still don't really know all of that by, until we see the long term. We're just kind of going on prevalence of those conditions that we are seeing.
Right. And
that's one factor that may factor into it.
Mm-hmm.
Yeah.
So what I hear you saying through the course of our whole conversation today is, be open with your vet, be honest with your vet, have this discussion with them, talk to them through all the details, your thoughts, and if you need to schedule 2 appointments and like your vet may not be expecting to have this long discussion with you, so maybe you need to let them know, hey, I got quite a bit of stuff I want to talk about, send them some topics, schedule multiple appointments or phone calls, or you can talk these things through with them so that you and your vet are both on the same page as far as ensuring the best care for your pet.
Absolutely. And the technicians usually sometimes they're the go-between, but oftentimes they're going to go straight to the vet, ask them all the questions, and they may be the one communicating, but eventually just keep coming back with the questions till you feel that you understand their reasoning and why. Yeah. And if you differ, it's okay. And, we've got time to work through those. Right. And it's very, I think we make sure we're talking about the individual dog, because we sometimes have behavioral problems in some males that don't get neutered and in others you don't. Right. And some people can't stand the fact their dog's going to lift their leg on everything in the household. We need to address that if we're not neutering, because that could happen. Right. Or they run off after females, they're more likely to kind of break through the gate. Mm-hmm. You may see aggression. Yeah. And just really talking about, but that may not actually really be about your pet. So and then I guess the only other thing I wanted to add in was I'm getting questions all the time about pet insurance. Mm-hmm. And so that's a big area that I feel like we're all getting into. And so be sure to ask your vet about those options. And that really has bridged the gap in the expense of how we're affording to do, because that's probably the biggest complaint I have all the time is that, I can't afford the $4,000 emergency vet visit. Right. And I understand many of us cannot. And so I'm really highly advising to have pet insurance, not so much to cover everything, but to cover the big, major bad, expenses. And the ugly emergencies and cancer and the unexpected. Because it really does seem like we're entering that world whether we want to or not. Yeah, absolutely. Do you have a pet insurance company that off the top of your head you like, or I
that
do.
You've seen in
I
your
kind
experience?
of partnered with Trupanion, and just because they will integrate with us a little bit and allow us to just run the actual invoices right through there, and then they tell you right away that they cover this, and the rest of it's like an 80-20 rule, kind of similar to Meet the Deductible. Right. There's 2 or 3 that are out there that I think that are probably the kind of the best, and then you'll have some that, and you can pick their brains because they're there to really provide that customer service to advise you on which insurance would be best. Right. And some of the premiums could be affordable as much as $25 up to $55 a month, depending on the age of your pet. Yeah. So
that helps out. That's worth it when you got that, $4,000 ACL surgery. Then 6 months later, the second ACL, $4,000.
Absolutely, yes.
Or the cancer treatments like you talked about. I can only imagine those.
Yeah, because the average, I would say, we're spending anywhere from $2,000 to $10,000 a year.
Yeah.
On our pet, just give or take.
So,
that's a lot.
Yeah. But wrapping it all up, can you kind of give us your information? I know you're highly booked on clients, but if people want to get a hold of you, contact you, I don't know if you even have openings right now. Can you kind of give us your info?
I do, and it varies. Like I'm right now saying I'm taking new clients after September 1st just because my schedule in the summertime will change, and then my kids are back in school and I can work a little more full time.
Yeah.
So I'm with Charleston Veterinary House Calls, and I have a website. It's just either the charlestonveterinaryhousecalls.com or CVHC. Abbreviated, and you can find me through that. And then, my telephone number, if anybody wants to take it down, 843-901-7872. Once I partner, I usually will set up a consult, make sure it's the right fit, give estimates, and then we'll set up the house call visit. Right. Most of the time I can get people in within a week or two during the non-busy. And if it gets pretty busy, you may have to wait. But I do try to make sure I'm available for my current clients. That way, if I can get to people. I'm in Mount Pleasant, West Ashley, out toward where I live, out in Hollywood area. I do come to Somerville, but it's just not as much, maybe about twice a month.
Yeah.
And I just make sure I plan around the traffic as best I can.
Absolutely. That's critical,
It is. But all services from preventative to sick and, of course, into the life. And that's probably a big niche. Hospice, geriatric care, into the life care.
Right.
It's priceless for this service to have someone come in.
Absolutely.
And it's wonderful for the pet.
Yeah. Big deal, too, that you can do that in the comfort of their own home. You know what I'm saying? In their last amount of time with us, which is a very sad and special time, and the dog and owners, time together.
It is, and it's just really hard to plan for that. But if to have someone come in and it be peaceful, it's really just been a very peaceful way for both my clients and their pet, and not to be stressed to have to leave the home. So that's probably what I end up getting some calls, even from people I don't know that aren't my clients, and I know that's a common reason to call a house call vet. So absolutely.
All right, well, Nicole, we appreciate you coming out today.
Thanks.
We know it's a little bit of a haul to get out here, but we appreciate your time. Very honored to have you with us, and hope to see you again in the future. I know you've come out to one of our group classes, so hopefully have a little visit there. But you guys reach out to her, hit her up if you have questions on anything, or if you're looking to get on her list of people. She's super busy. So plan ahead of time. Reach out to her if you want to get on her list. And thanks again for coming out. Thanks to the listeners for tuning in. And we'll see y'all next time. Out.